Good afternoon. The meeting will now come to order. Hello, I'm Marcia Herbert, President of the Board of Education. I would like to welcome you to the February 24th, 2021 Board Updates meeting. In keeping with the board's commitment to open communication with the community, this meeting is being streamed live on the CCPS website at www.carrollk12.org and broadcast live on Channel 21. We are also recording this meeting so that it can be accessed on demand on our website and broadcast through the month on Channel 21. This will be a hybrid meeting in which board members are present in the boardroom. However, staff will be participating virtually. We will not be holding citizen participation during this meeting, but citizens and employee groups are welcome to submit comments via email or U.S. mail to the board for public comment. Comments received will be published on our website. For board members and staff who are participating in the virtual meeting, I would remind us all to silence our cell phones and other devices around us that the microphones may pick up. Also, we should each silence our microphones when we are not speaking. At this time, please stand for the Pledge of Allegiance, followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. At this time, I need a motion for the approval of the agenda.
So moved.
So moved by Dr. Dorsey, and I need a second. Second by Donna Savigny. Comments, questions? Order? Okay, all those in favor, please signify by saying aye.
Aye.
Opposed? Passes unanimously, and now we are in session. Dr. Lockhart.
Thank you. Good evening, board members. The purpose of tonight's session is to follow up on your action from the February 10th meeting. At that time, you directed we develop plans to move to 5-day per week in-person learning at Career Tech, Carroll Springs, Gateway, and Crossroads, and 4-day in-person learning at all other schools. Your direction was that this phase-in be accomplished by March 22nd. So tonight's meeting was established to present for you and the public how we would revise our approved reopening and recovery plan to accomplish your directive. After you approved a revised plan this evening, it'll be submitted to the Maryland State Department of Education for their review and reapproval, as we had mentioned on the 10th. Our objective this evening is to present the major areas of substantive revision in the plan so that we all understand them and that they are presented in full transparency for the public. Also, we've had a chance to consider your February 10th decision with key staff and schools. We're going to highlight and discuss some of the areas where we see the greatest impact, share some ongoing challenges which will be a factor in implementing the decision, and lastly, share some additional strategies we are working on to implement in advance. Much of our focus this evening will be in addressing the impact on social distancing. Recommendations on physical distancing from the CDC, Maryland Department of Health, or other bodies have always been the one mitigation strategy that limits our ability to return more students to schools at one time. Therefore, it shouldn't surprise anyone that this is the greatest substantive change to the plan in this particular area. The state has required from the beginning that we must note by reference mitigation strategies from Maryland Department of Health, CDC, and the APA, the American Pediatric Association. Within days of your last meeting, the CDC issued new operational strategy guidance for K-12 schools. So we have incorporated that for reference, and we'll discuss social distancing relative to that revised guidance. Again, I'll remind everyone our existing plan was officially approved by MSDE, and the revisions we conclude with this evening will be resubmitted to them. We're going to start with Mr. Singer, who I believe is with us for updates on COVID metrics and vaccination, and then we will have a group of staff prepared with a presentation to review the highlights that I've just noted to you, and then we can get into some important conversation related to the issues of the plan and moving forward. So, Mr. Singer, are you with us here?
Good evening, Superintendent and board members. If I could get the slides loaded. So you can go ahead to the next slide. The most significant thing that's happened since the last time we had a board meeting, I know several of the board members referenced new CDC guidance that was due to come out, and as you guys know, back in January and February when we were making decisions, I thought we were a little bit ahead of where we should have been, and I made certain recommendations to you all, and you made the decision that you made, and we moved forward, and that's fine. I just want to point out this is the most recent template that's come out from CDC, and I still feel that we're a bit ahead of the game as far as pushing to fully reopen, and I'll explain why just based on this chart and where we are. New CDC guidance actually has some options for being fully open for in-person instruction, and talks about physical distancing of 6 feet or more to the greatest extent possible when we're in low or moderate transmission. Up until last week, we were in what's considered to be a high rate of transmission. If you look on the right-hand side, we've listed where we are with the positivity rate, which is in the low category. But where we are with the cases per 100,000 is considered to be in the substantial category at 60.5. To get to a moderate rate, we need to be down between 10 and 49 under the current CDC guidance. And we're really, the way we're trending, we're really not all that far off from there right now, but we haven't reached it yet. And if you look at this CDC guidance and what's in the chart, essentially their recommendations is that that you would have school in a hybrid model, maintaining a minimum of 6 feet or more of distance is required under their recommendations. This is different than what the guidance used to be. In order to meet the guidance to the greatest extent possible, if you look in this chart, we need to get to a moderate transmission or yellow level as they presently have it. Now, I'm not telling you that you're bound. I know I've talked to the Department of Health. They feel like you should be bound to meet the CDC guidance and requirements. Ultimately, if you decide to submit a plan that doesn't comply with this guidance, that's your choice. And I guess it'll be up to MSDE and you all as a board and a school system to work that out. However, my recommendation would be that, if you take a look at the trends that I'm going to show you over the next couple of slides, is maybe to push this off a couple of weeks and see if we actually get into the moderate or low rate of transmission. My biggest concern right now, and I'm sure the superintendent would likely agree with me on this, is I'm just concerned that when we start putting more students much closer together, the number of people that we're going to have to put in quarantine or isolation is going to grow exponentially. And if the level of transmission continues to go down, we may not have that problem, and it may just be wise to give this a couple of additional weeks and see where our transmission levels go. Next slide, please. You can see, I guess, since we hit our peak around January 3rd, we've been in a pretty steady declining trend. And, I have no reason to believe that that's not going to continue. We're getting more people vaccinated. We're starting to get into springtime when people will be spending more time outdoors. I think a lot of the travel over the holidays, the fact that we were indoors, and essentially we didn't have anybody vaccinated before the first of the year is probably making a difference in where these numbers are going. That's not to say that we're not going to potentially see another bubble or another spike, but the trend is definitely in a positive direction, and we're seeing improvement. Next slide. And this is our 14-day rolling average, and obviously you can see the trend pretty clearly from this chart. Next slide. The only thing I'd note on this chart is up until about October, late October, the cases we were seeing in the age group that's less than 18, which is primarily your students. Some of your students are obviously in the 18 to 29-year-old age group as well, but it was pretty well under 5 cases per week that we were seeing, and then during the it was generally that line was pretty much below all the other age categories. It's still pretty much below all the other age categories, but it's trended up significantly higher over the months leading into the holidays and into recent weeks. It is actually this week. It's kind of in it's in a spot where it's dropped off quite a bit for the week. But that's just a 1 week average, so it's hard to really compare that. But we did see the number of cases in people that were under the age of 10 go up significantly. They've been relatively flat the entire pandemic, regardless of where the other peaks have gone, starting in October and going through the beginning of February. Next slide. This is just our hospitalizations, and they do tend to lag a little bit. The hospital is doing much better. Last I checked, they were at about 15 patients that they were treating for COVID, which puts them in a much more comfortable spot. Hospitalizations are definitely improving. Next slide. And this is our hospitalization and deaths by age that I've been sharing with you on a regular basis. Next slide. This is just our COVID-related deaths. Still seeing some deaths. They tend to lag the cases, and still seeing deaths in the community and in some of our facilities. And hopefully, as the cases tend to drop off, we're going to continue to see the number of deaths drop off as well. Next slide. And it's just the pyramid talking about 1A and 1B. Carroll County Health Department is primarily, we're pretty much done with our 1A. We've offered a lot of opportunity for that. We're making significant progress in 1B, and we're hoping in the next 3 or 4 weeks to get through most of 1B and then be able to move into 1C. Next slide. This kind of just speaks to the same thing I was just talking about. And the 1B people that we're primarily concentrating on now are adults that are over 75, education and childcare. We've done some private school vaccinations and daycare vaccinations. We haven't gotten to higher education yet, but I'm planning on reaching out to them in the next couple of weeks to do that, and continuity of government. And we'll continue to work to try to get through the public school teachers. Next slide. This is just our vaccine distribution. Some of the weeks you'll see are where we've vaccinated people. We've had higher numbers than what we're actually allocated, and what we're doing there is essentially, I find out we're actually finding out a little more in advance now, but I find out on Friday how much vaccine I'm going to have that's going to arrive on a Monday or Tuesday. And normally I schedule my clinics on the following week based on the vaccine that we receive on Monday and Tuesday. We've actually been front loading some of that. This week we actually, instead of spreading your doses out, we've been giving 150 doses to the school system every time we get a vaccine allocation that's 1,000 doses or more. Instead of spreading that out over the next 3 weeks, we just lumped it all into a clinic that was run today and vaccinated 500 teachers today. So the next couple of weeks, we're not going to be allocating additional vaccine, but we essentially got that vaccine to you a little bit early so that we could get more teachers done a little bit more quickly. Next slide. This is kind of where we stand with the people we have vaccinated. Of interest to you is the education and continuity of government. We've vaccinated approximately 4,599 approximately. Whoops. That's not the right slide. I don't know what happened there. Can we get back down to where we were?
Do what?
Somebody's got me back up the top.
Somebody else took control?
Keep going. Keep going. One more. Yeah, right there. So, there have been 4,599 people in the, and this includes public schools and private schools that are lumped into this group. But there's almost 4,600 people that have been vaccinated between the partnership between the health department and the public school systems. Your school nurses have been doing a lot of those, been administering a lot of those vaccinations. And in talking with Mr. Streaker, it looks like we're at a point now after today, I believe, where we think we've got about 1,776 more people who are interested in being vaccinated, who are in the public school system, that are either your staff or bus drivers or folks that are still on the interest list. And that's not to say that they might not get vaccinated somewhere else or whatnot, but those are the numbers that we're still looking to try to reach. So we've made a lot of progress. We still have over 1,700 people that are interested in being vaccinated that we believe we need to still reach. Next slide. This is the website that I always remind people where we are with our vaccination information. Please feel free to visit our website or call our COVID hotline, 410-876-4343. Next slide. And that's all I essentially have for you today. I'll be glad to hang around and try to answer any questions that you have as you proceed through this, and we'll go from there. So thank you.
Mr. Kyler.
Yeah, a couple clarifications. I was very anxious to see the new CDC guidelines, and when I did, it really seemed strange, the difference between positivity rate and cases. They changed their calculation, didn't change the standards. If I look back, and correct me if I'm wrong, to get to blue, 0 or 9, I think the lowest we've ever been is back in June, we were 17. And
if you want to go back to that slide, let's so we can talk about it if we can. Can we go back up to the second slide on the presentation, please? So let's talk about this real quick. And I've got this bar that's in front of me, and I can't see it on my screen. So let me I got to look on my computer. So the 0 to 9 per 100,000. Maybe we're not going to get there, but if you look under the moderate level of transmission, Mr. Kyler, if we get to 10 to 49, it's essentially the same thing, regardless of whether you're in the moderate or the low risk of transmission. Right now, we're at 60.5 cases per 100,000, and it's clearly stated in the CDC guidance that if the positivity rate and the cases per 100,000 are different, and where they measure, that you use the higher of the two. So right now, from a positivity rate, you're in the low transmission level according to the CDC guidance, but the cases per 100,000 over the last week have you at like 60.5. Have us at like 60.5, and I would think, depending, just looking at where the trends are going, that we may get into that moderate level of transmission, which is moderate levels considered to be 10 to 49 within the next couple of weeks, potentially, if the trend keeps moving the direction that it is. And nobody can ever make you a promise on any of this stuff with this disease, but right now we are in the substantial transmission or orange level, and going to school in a full in-person manner of instruction and having less than 6 feet would not comply with this guidance.
And
Is that answer your question, or?
I recognize that, and like I say, we never would have been in the blue. So I was fortunate enough to do a webinar, and I did some email exchanges with a couple of the PhDs with CDC, and nicely said, based on your numbers, 90% of the schools in the country couldn't be open right now. But the president keeps saying we need to open. What's happening? Their suggestion was minimize social distancing, maximize contact tracing, and some other stuff, we don't want schools to close, we don't want schools not to open. Now, granted, that's not what you've seen in black and white, and people will probably say I made it all up, but I'm really concerned about this, and a couple things. One, we're planning to open in a few weeks, not tomorrow. And I'm concerned if we keep kicking the can down the road, it seems like it's always going to be a reason. The other thing I wanted to clarify, if you go to the COVID cases, and even with my glasses, I don't read it the best, but the trend for 18 and under, since we opened school, has just gone consistently down. So to me, that's one more proof that schools and sports and everything we did obviously was not a super spreader for the community. Cases decreased. And again, I fully recognize correlation between two events doesn't mean cause and effect, but it's definitely a factor. It's just and I understand where you are, and I understand they just changed this. Has the governor changed his? His was 35 to be in a total green. Has the state changed theirs, or is their mindset now they want to follow the new CDC for schools?
I'm not sure which guidance you're talking about with the state. Actually, I'm not sure that they ever changed the original guidance that they came out with, where they were looking at 15. I don't know, Dr. Locker, do you know, that guidance is still out there. Where does the state stand on their cases per 100,000? Do you know offhand?
Right. I don't believe that guidance actually exists anymore in the updated document that we got in early February. I'll look to John or Cindy, but I don't think they continue to utilize the existing metrics anymore. John, I don't have a copy of that one right here at the table with me.
And the last conversation I had with MDH, because I asked them, I told them that what you were planning to do, and they said, well, they're supposed to comply with that CDC guidance. And you know, I heard what you were saying about you were talking about the social distancing and whatnot. I'm just trying to understand how you think that fits in with what's in here. I hear people saying reopen, but the problem is there are a lot of school systems that haven't been reopened at all. I mean, if you look around the state of Maryland, there's some school systems that haven't been open since to a large number of students since last March, so in over a year. You guys are certainly far ahead of everybody else, and I'm not. Mr. Collier, if you take a look at the numbers over here in the right-hand column, where we're talking about where we are total cases per 100,000, we're at 60.5, and essentially to get to this level where they say you'd have a potential for reopening, we're talking about wanting to get down below 50. My biggest concern is when we start exponentially exposing, having close contact of less than 6 feet with students in the classroom, if we still have this substantial level of transmission, and we wind up having to quarantine a whole bunch of kids, that they could potentially drive you to the point where you may be stuck in the situation where we've talked about not wanting to have to close the school, but because of the number of kids or teachers that you might have in quarantine because we're not distanced, and that's not a choice on your part. If people are close contacts and they're close contacts with somebody that's suspected of having COVID, they have to be in quarantine. You could be faced with the situation of having to close and reopen schools, and we're really not that far off of what that moderate level of transmission is. And I don't remember exactly what the dates were that you all set, but I really think that in order to have a reasonable plan to have full in-person learning and be able to reduce your distance below 6 feet, you really need to get down to the point where we're at least in that moderate transmission range.
Mr. Kyler?
And just for the record, I didn't say reduce physical distance to the greatest extent. Their paper does. And actually, Greta Massotti and Donna Harris-Akins, two PhDs, the senior scientists with CDC, and the CDC corrector on schools, that's who said it. They just said it to me. And again, that's all I'm saying. It's pretty obvious that the way the cases are done in the CDC new document is flawed. I mean, with a positivity rate of well lower than we thought we'd see. And I know it says to use the worst. I understand that. And I also understand if we're going to compare the state of Maryland, everybody hates when I say this, York County, Adams County, they've been fully open since August. And it's worked. And I mean, we're going to talk this when we talk the plan, but I think our kids deserve it. And again, if everybody disagrees with me, chime in, but,
Ms. Savigny?
No, I agree with what you're saying, Mr. Kyler, and Mr. Singer, I understand where you're coming from, but if we see, you say that, we're ahead of other counties in Maryland, and that is true, but we're well behind many other states in the country. So I don't think it's really a fair comparison to just say that, we're ahead of the rest of Maryland. I think you have to look at, and we've seen the downward trends. I mean, when we opened back up on January 7th, we were at the top end of the curve, and during that same time, the cases have dropped off exponentially. And that has to be factored into the whole equation. And the fact that you had said that you wanted us to wait a few more weeks, and we are. We basically said we wanted a phased plan, and that would be March 22nd would be the final implementation. So with the way that this is trending, we would be about where we want to be by the time that we're talking about the March 22nd date. So, and the fact that we got 500 teachers vaccinated this week, I think that's fabulous. I really can't say enough good things about the way the vaccinations have been handled in the county over the last several weeks. And we've got a significant chunk of our teachers and educators vaccinated. So I think that all things are trending in the right direction, and we're talking about a final implementation of the full return in 4 weeks. I think all of that hangs together.
I know, Ms. Savigny, when we met January 3rd, and you look at the numbers on January 3rd and look at them now, it's unbelievable improvement. Ms. Battaglia?
Mr. Singer, I had a couple of questions. You had talked about the quarantine concern that you had. One question I had is, per the new CDC document, it says that if anyone has received their vaccines, they no longer are required to quarantine. Is that correct?
That's not what the state of Maryland's guidance is at this point in time, and they are considering changing that. So that may help you with your staff when the state does. But at this point in time, the state's contact tracing, and there's been discussion about changing it, but it hasn't happened yet. They are requiring people to quarantine.
Okay, so the state hasn't changed their guidance, but the new CDC had, correct?
That's correct.
Okay.
So it's not going to change what you're able to do until the state decides that they want to take a different approach.
Okay, so I wanted to ask on that one. And then the second piece I had was regarding the cases per 100,000. Does that include positive cases in facilities or no?
The cases per 100,000 is simply all of the cases in the county by PCR test, and it does include all the cases, including community and the ones in the facilities. The ones in the facilities have dropped off greatly because those were the first group of people to get vaccinated, to be offered vaccine. And at one point in time, we were seeing a lot more facility cases than we were community cases, but those facility cases have been extremely low numbers the last few weeks.
Is there any way we could potentially, when you give us updated numbers, to exclude facilities in that number? And the only reason why I ask that is because, that age group and population is isolated more from the general public and the community. So I don't think
That's
it's,
not how this is supposed to be calculated at this point. I can give you the numbers for the community, but the cases per 100,000 is calculated based on this. I mean, you could also make an argument that we ought to be throwing in, if you go, can we get the next slide just real quick? One of the things that we're excluding that I don't think we should be excluding, and I mean, if you want to make arguments about what our case rate really is, can you go to the next slide? Nobody's sitting at the computer.
Yeah,
But
There
you're
we go.
saying the probable cases.
You know, the other argument you can make on this, while we're including facility cases, which I think are only a small handful, 3 or 4 or 5 a week, you know, you could make the argument that this orange bar that's up here that's not, that's actually not included in the calculation really should be, because this is those presumptive positive cases that we have where people are not following up with a PCR test, but have simply gotten a rapid antigen test. So if you were looking at it this way, our rates of transmission in the community would be much higher. I just, you know, I don't think there's any reason really to exclude those cases at this point in time, but I can certainly share with you, and I can even send you the number we've had over the last couple of weeks of community versus the facility cases. And one of the things we're not even talking about is this additional, if you look at just the week of February 14th, that's probably roughly 80 or 90 additional cases that are not even included in the data because they're not PCR tests, they're rapid tests.
okay. I mean, please understand, I wasn't arguing the data. I was just trying to grasp on, you know, we keep concentrating on community. And we don't want, I mean, to me, I don't think we should be including those that are in the facilities in the numbers. They're not more or less, you know, out and about and doing things that the rest of the community would be. So please understand, I wasn't trying to disrespect you or anything in that manner. I wanted to just see if it would make more sense to not include the facility numbers like that.
Well, I'm calculating it the way that the CDC is calculating it. You can go right out on their website and it mirrors what the numbers are that I'm giving you. I actually sent a link, I know, to the superintendent and his staff, and I'm sure, I don't have it in front of me, but there's a link. You can go right to the CDC website. If you want to look every day, you can click on Carroll County and it'll give you that number per 100,000 over that 7-day period so that you can kind of look at where we are. Based on their calculation and how they're saying it should be calculated. I don't have any problem with sending you our community cases versus our facility cases over the last several weeks. I can send that out to you. But when we're talking about the CDC guidance that's on the previous page, it's calculated in a certain way, and we're calculating it the same way that the CDC is doing it.
Okay, thank you.
oh, Mr. Weaver.
I just had a couple of questions. What do you do with quarantined students? Do they go back to hybrid learning while they're quarantined?
Virtual. Yeah.
Okay. And then who does the contact tracing?
So, Mr. Streeter, briefly, who does the contact tracing, but yes, if students are quarantined, they can participate in virtual learning.
Okay.
So the contact tracing is officially a function of the health department. The school system supports contact tracing efforts by identifying close contacts of persons under investigation or students who have COVID, and we supply that to the health department. So we don't officially conduct that business, but we support it.
And I would just chime in on that to say that there's no way that we, that without the assistance of the school administration and the school nurses and everybody else who's involved in this effort, it's a very much collaborative effort, that we would know who's been in close contact with a student that's either tested positive or suspected of having COVID. It's not something we could easily do, and we'd wind up quarantining a lot more people than would be necessary if we didn't have the support and cooperation of the school system.
Ed, to your earlier question, I did get confirmed from staff that the previous metrics that were utilized, that we looked at on your slides for the first half of the year, are no longer contained in the current documents from MDH or MSDE.
Mr. Kyler. Sorry, I
Yeah.
couldn't see it. Your
Yeah,
computer was blocking.
Yeah, last question, and I want to say before I ask, I really appreciate that you do this, you come to our meetings, you give us this information. I know I asked a lot of questions, but you know me, I'm hard-headed. But the trend has gone down, and I feel pretty strongly, I don't know if you have an opinion, and I know you're given what you're given, but how can they have metrics that the positivity rate can be, a week or two ago, the positivity rate was blue and the cases were red, how they can be that diverse. And you know, I've said before, to me, the positivity rate is a mathematical calculation, and I put a lot of faith in that. Cases, you know, more testing, less testing, whatever. But you're comfortable with either, correct? Or do you put more, you like the cases better, or which way do you?
I've always said I thought the cases gave us a more accurate picture, because you could test a lot more people that don't have symptoms of COVID and wind up diluting your positivity rate. I mean, I really have always felt that the positivity rate is something that's easily manipulated. If you know you got a group of 100 people and you know that 10 of them are sick with COVID, I think that's a good indicator of how much spread there is in that group of people. That's just my opinion. I've felt like that all along, and I think I've consistently told you that I really thought that the positivity rate fluctuated up and down a lot depending on how many people we were testing. You run into right now. There's a statewide order that if you travel, you're supposed to quarantine unless you've been tested. So there may be a lot of people who might have decided that they're going to go to, I don't know, let's say Michigan, and come back to Maryland. And if they're going to follow the order that's in effect, then they're either required to stay home or get tested. So we may be testing a lot of people who aren't sick, and that artificially would deflate the positivity rate. So as long as we're testing people who don't feel like they're sick at all, I'm not sure that from my perspective, I'm not sure the positivity rate means as much to me. But if you know how many people in the community out of a given population are sick, I've always kind of put a lot of stock in that. And I think it really tells us, relatively, we were talking at one point in time how, comparing about how many people out of 100 were sick in any given week. And essentially, to me, that tells you how it's spreading in our community. It's the positivity rate I've always found to be a little bit of an artificial number, depending how many people we're testing that really don't have any symptoms or any indication that they would have COVID, but might be deciding they're going to travel or might get tested for another reason because their employer's requiring it. And quite frequently, those tests are going to be negative, and we would never expect those to be positive, and it's going to drive positivity rate down.
Thanks. And thank you for what you're doing with vaccines. I know you can't please everybody, but you're pleasing a lot of them.
Well, people who are, this is a really bad year, and I'll just, this is Maggie Kuntz, who's our PIO. She said this is a really bad year to be 74 because we're focusing on the people who are 75 and over. And people who are 65 to 74 are really mad at me right now because the governor says we're in 1C and we can vaccinate everybody who's in 1C. And I'm like, there's a much higher risk when you're over 75. So we're sticking to that until we can get the majority of those folks knocked out. So it's a really bad year to be 74. And some people call me and complain, well, I turned 75 in April. Well, you got to draw the line somewhere when you're making this kind of a decision with the entire population. So we're doing the best we can. And, it'd be one thing if we weren't getting every shot out that we get every week. It's just that we're very supply limited on the vaccine, and we're having to make the best of what we're given.
And we thank you again. Any other comments? Thank you so much, Mr. Singer.
No problem. I'll hang around for a bit.
Please
And if there's
do.
other things that you need to ask as you go along, I'll be glad
Okay.
to try to chime in.
Thank you. Dr. Locker.
Okay. I think we have yep, there it is, the presentation we want to go through. And so, John, are you ready?
John, okay, all right, just check it. Okay.
I am ready, but I wasn't sure I was unmuted.
You're unmuted.
And is the presentation still on the screen correctly?
Yes.
Yes.
Okay. Then just give me, I'm sorry, just one more second. Is it moving forward?
Yes.
Okay, very good. Then we will proceed. I'm sorry for that brief technical delay. I think Dr. Lockhart covered these background points pretty clearly in his opening remarks, so I won't spend more time on them. I'll skip right into the presentation. We will have a number of staff participating throughout, and at certain key points they'll be adding to this presentation. But I also invite, obviously, Dr. Lockhart, but Ms. McCabe, Mr. Anderson, or any of those key staff who want to clarify something to do so as we go. We invite certainly all of your questions, all of your discussion. You may certainly ask as we go, or we certainly have it set up to do so at the end as well. As far as going back to the purpose for tonight's meeting, ultimately, as Dr. Lockhart outlined, ultimately our goal is to leave here with a revised plan that you've approved or that you're comfortable with. And then that'll be sent to the State Department of Education for their review and their reapproval or whatever process it is that they're going to use. And we're going to talk about that a little bit in a second. But we wanted to try to put this presentation together so that you and the public weren't stuck with trying to flip through a very long document and just sort of find those points where there's been some substantive revision made. And so the purpose of doing this presentation this way is to draw attention to where you can go and find those those parts that are now revised. That being said, the marked up version of our existing approved plan, I think, is now available as part of this agenda. So for anyone in the public who wants to take the plan itself and go through it and look at it that way, that's available to do so as well if you prefer to look through very carefully.
And John, if I might real quick, I want to remind everybody, we spent 3 months roughly with a ton of time and people giving input to all of the plans, mitigation strategies, et cetera, that went into that plan. It was very thoroughly vetted, and then very thoroughly vetted by MSDE as well at the time. So there are some really good plans in place. So I want to make sure folks know this isn't something that wasn't given a considerable amount of time out of the gate.
Correct. Thank you.
Doctor, and along with that, and stakeholder input.
Correct. We had a variety of stakeholder groups that were a part of, if you recall, we had different groups tackling different pieces of the plan. So,
Ms. Savigny?
I guess I just had some questions and comments on this specific. And Mr. O'Neill, I appreciate your laying out exactly the pages and locations where things changed. That was really helpful. I did have some questions on certain of the revisions. I didn't know when we wanted to ask those or make those comments.
That's up to the board. We could do that as we go, or if you'd rather see the full scope of the presentation and then have that discussion as a whole, we can do it that way as well.
Okay, yeah, so why don't we go, we can go through the whole presentation
Yes,
and
let's
then
do the
ask questions at the end.
presentation,
Okay.
and then
Yep.
we will have questions. I think that would be the wise.
Very, very well then. And so the purpose of this particular slide is to sort of draw attention to those areas where you would really see some substantive change. The executive summary of our plan has been updated to reflect your February 10th meeting and decision. And then also, for the sake of the State Department of Ed or any person in the public, that new revision, that new addition to the executive summary does attempt to list out some of the pages throughout the document where someone could go to look for those specific changes. There's also a summary sheet online that I think Ms. Savigny might have referred to that lists out pages with changes. But these 4 highlighted sections on the screen doesn't mean that there aren't other places where there's been an edit. Not trying to mislead people, but some of those edits are not substantive. So for instance, the cover page itself has been changed to reflect February 2021 as a revision date. This deals with, the substantive changes to the plan. That's the kind of distinction we're drawing here. Obviously, your action on February 10th adjusts what the school operational schedules will be, the instructional schedules will be. So that's an area in the plan that has been revised as well. Those major revisions would be seen at the very end of the second section of the plan, which is that section is called Academics, Equity, and Accountability. And then it also carries over into the very beginning of the third section, schools and student support. And you can see the schedule, the impact on the operational schedules of the schools there. We've talked a little bit already tonight about references to social distancing throughout the plan. Anywhere where there was a reference to the social distancing of students, or at least it was their intent, that anywhere that there was a reference, whether that was in schools or even on school buses, for instance, then we've made an amendment there. We're going to leave that for the moment, but we're going to come back to that topic in this presentation and spend quite a bit of time on social distancing. So this is just kind of just an overview, but we're going to come back to that in some detail. And then lastly, Dr. Lockhart already noted this as well, but I would just add that we have incorporated the new CDC operational strategy by reference. At least for me, I'm sure for my colleagues in the last few days, received quite a few calls from citizens, folks in the community who would, wanted to point out, were you aware of this piece of guidance that came from this organization? In one case, from the President's Department of Education. That's one example. Were you aware of this? Why didn't you incorporate that in the plan? And the answer, I think, generally would be, yes, we're aware. We try to stay aware. We try to read everything we can and review it and talk to our colleagues here and across the state. But the reason we incorporated that reference is because from the very beginning, and it hasn't changed, even in the new MDH or Maryland Department of Health documents that Dr. Lockhart just asked us to verify, the state requires us to reference guidance and recommendations from the Department of Health, State Department of Health, and from the CDC. And so that's why that new reference is incorporated, that new guidance is incorporated by reference. There's no attempt to not have any other guidance or recommendations that exist out there, or a report be excluded or included. We're following what the state has laid out for us from the very beginning, and things that need to be referenced in your plan. That's why that update was made, because that is the newest guidance from the CDC. So hopefully that makes sense for some folks who've been wondering, why not this, that, or the other. I have now apparently lost my ability to click forward. Am I going forward again?
Yes.
It did.
Oh, thank goodness. So just another word on the State Department of Ed. Dr. Lockhart reported to you on February 10th at your last meeting that he had conversations with the state superintendent, and that substantive changes to our approved plan would need to be resubmitted. So our goal this week would be, following tonight's meeting, when you make whatever changes you ultimately approve, we will get those tidied up as quickly as we can. We will send a marked up version and a clean version of the revised plan to the State Department of Education and ask that they conduct that review and approval. We don't know for sure exactly what process they're going to use this time for a second review to some, to a few changes, and we don't know for sure when to expect it to be returned to us. But we did want to share with you that after your last meeting, we did make contact on the telephone with some of the key personnel at the State Department of Ed, just to alert them that this meeting was going to happen, that they should expect a plan from us tomorrow or Friday at the latest, that you had set a timeline for implementation at your February 10th meeting. So time, is of the essence to us. And we had some conversation where we could say, here's where we anticipate these revisions are going to be in the plan, to kind of just give them a sense of what they'll be looking for. So I can't tell you when they're going to send it back, but I can tell you that we tried to lay the groundwork to give them a leg up and to move it as quickly as we can. So that's about the extent of what we know for sure. will happen at the state level. And then that brings us to what we're calling here the areas of most impact, meaning the parts of the plan or the parts of our operations that your decision will have. And we've broken that down in our minds into two major categories, that of social distancing. And then we do want to spend a little time again tonight talking about where we sit with our staffing situation, our staffing constraints, and, just the kinds of things we're looking for there and trying to keep an eye on. So social distancing, Mr. Singer's covered that a little bit. You've had some dialogue with him. Dr. Lockard made reference in his opening remarks that this has always been the mitigation strategy from any set of recommendations that makes it the hardest to bring the most amount of students into the building. But this will be my best attempt to explain overall what the change between the existing plan and the revised plan will be, or what it will mean. Under the current plan, the existing plan, what we've essentially said to the community is we will do our best to meet what was and essentially still is the CDC recommendation of achieving up to 6 feet to the extent possible. But we also acknowledged in the original plan, but we know that there will be some situations in which we may not be able to reach exactly 6 feet. And so we were going to try to stay within a 3 to 6 foot range. There were some references to that in the original plan. And kind of the difference now, and this is going to be covered again, there's more to come on this topic and examples from the other staff who are about to chime in. But what we're essentially saying now is a lot of this will be contingent upon how many students report under this new model. Mm-hmm. But in general, we're going to do our best to achieve the maximum amount of social distancing possible in each setting. But it may vary from setting to setting. It may vary from school to school, from possibly even classroom to classroom, even for a given student as they move throughout their schedule for their day, from school bus to school bus. And, again, we're going to come back to these things now, but that's sort of how, at least I view, what does this revision mean relative to social distancing. But I know we have Ms. McCabe and some of her folks and Mr. Anderson and some of his folks to talk about some of these specific examples laid out here.
Thanks, John. I'll go ahead and start with classrooms. I think Mr. O'Neill did a great job of discussing the classroom situation. I think we as a staff are going to do our best to social distance or physically distance students as much as possible in all of our classrooms. As he said, there could be some classrooms where there are 6 students there at one time. There could be other classrooms where there are 18 students at one time. So we're going to do our best to distance depending on how many students come back for the 4-person hybrid model. As far as our cafeterias go, since we've been in the 2-day per week model, we have used, for the most part, we've used desks and other kinds of seating in the cafeteria to try to keep students 6 feet apart as much as possible. With a change to 4 days a week, some schools are going to need those desks that we've been using in the cafeterias back in the classrooms for student use. And then also, what we have been doing is using classrooms as well as the cafeteria for students to eat lunch in. And that has helped us to spread students out further. But with students coming back 4 days a week, we're going to need those assistants to be servicing our students in their classrooms. So we'll have fewer staff resources for supervision, and we'll have more students coming back on the whole. So there may be cafeterias where more students are in the cafeterias than there was in the 2-day-a-week plan. And in some cases, cafeterias may need to use their traditional cafeteria tables with those bench-style seats. Again, schools would do their best to socially distance students as much as possible within that cafeteria area, but it would look different in many schools than it currently looks now. And I'll hand it back to John to talk about school buses a little bit.
Sure, I probably should have reversed those bullets for your sake. Was there a question?
No, not, well,
Well,
Dr.
I was just wondering while Mrs. McCabe was speaking, are we getting a handle on the numbers, the number of students that we're expecting back in this hybrid fashion for the 4 days?
So that's part of this presentation. What we're going to discuss, I think it's on the next slide or the one after, is communication with schools. And basically, our plan is after tonight to have principals communicate with their families to get from families how many of those students who are currently in the 2-day-a-week model are going to begin coming back to school 4 days. And we also may have some students who were in 100% virtual who will want to participate in the 4-day-a-week model. So that communication, we've been working on that communication, but we didn't want to send anything out to families until we had this discussion this evening.
Okay, because as you've been describing the different settings, I'm just trying to picture the possible numbers that some of these class sizes will be.
Ms. Savigny?
And Ms. McCabe, I was going to ask how many students we're generally up to now in the 2-day in-person.
So in the 2-day right now, in hybrid at the elementary level, we're up to 66% of our students are assigned to cohort A or B, 45% at middle school, and 34% at high school. So all in all, a little under 50% of our student population is hybrid at this point.
Okay, so that would be around a little over 12,000 then?
Yes.
So just real quickly on school buses, that would be somewhat similar to the conversation Cindy just had with you relative to each classroom. Just for everyone's, the public's knowledge and sake, the current plan essentially says that what we'll do on school buses is seat one child per seat, except in cases where there's siblings or members of the same household, they can sit together. Mm-hmm. So one child per seat, and we'll also leave the seat immediately behind the driver empty. What that means is the maximum number of students we could have on a bus today under the plan is 21. Well, except for siblings in the same seat, but 21, one per seat on a regular education bus, the full-size buses, and on special education buses, that generally would work out to 8 students per bus because there are many other factors that pertain to special education transportation. Like classrooms under the new model, it's going to depend on how many students do report and happen to be assigned to that particular bus route. And so some buses will probably certainly still be able to operate under the guidelines in the current plan. They won't exceed the 21 and things would be really no different, at least not in terms of the threshold of the plan. We do know that we have some buses, and most of them are elementary education buses that are presently running under the current plan at capacity of 21 or more with siblings, or very, very close to it. It's not necessarily a lot of buses, but some are near or at that level. And if the numbers are such that students do report back who aren't reporting now, then we won't, I don't know how else to say it, we won't be able to maintain the same system on buses at that point. Whoever the next students are who would arrive would have to share seats with someone who's not in their same household. That's how we would address it. But again, we're not necessarily speaking about all of our buses. We're speaking about about some of our buses. And then I will flip this back to Cindy and or Jason for a discussion.
Just 1 minute. Dr. Lockhart would like to say something.
Right. So I think one of the things, and the team has talked a little bit about this, as we've thought about how to gather the information from our families about what their intent to do would be moving forward, we have to the best of our ability, then communicate back what the numbers are looking like. And it's kind of a fluid process because it might not always be the exact same, but to the best that we can. For example, the bus. As a parent, I'd like to know, are there 18 kids on my child's bus that takes them to and from school, or are there 28? And I think what we need to do is gather that information and do the best we can to communicate that so people can make decisions about, well, I know that my child's classroom only has 12 kids in it. I'm okay with that, but I think I'd rather take them to school if there's going to be 28 kids on the bus. Same with the school. It's a little bit easier at the elementary school to kind of get a gauge on how many kids are in your class if there's limited switching of classes. A little more challenging at the high school or middle school, because one class you might have 15 kids in with you, another class you could have 6 kids in with you, depending on who's enrolled in those classes. And so that's a challenge, but I do think in order to be as transparent as possible, we need to be able to communicate that as best we can. That's going to take some work.
I agree. Communication is going to be the key.
So good evening, board members. John, thank you.
Hold on 1 second, Mr. Anderson. I think Mr. Kyler had his card
Well,
up.
I just wanted, maybe you want to let this go to the next slide, because I think connected to that, Carroll County's been, I think, way more flexible than a lot of school systems on kids saying they're coming or they're virtual and back and forth. And if that's going to be addressed down the road here, I'll wait, but I just wondered if you wanted to mention that too to the parents, what happens if they want to change.
Right.
And you've been more than enough flexible for that, I think.
Right. Well, we actually had some conversation as a board about that and set some parameters around that last time when we were talking about hybrid, and I think we landed on a 2-week notification if you're leaving virtual to come in. I would recognize that same threshold would be appropriate here, unless Cindy or one of the directors would tell me otherwise. We need a few weeks to plan for that, but then also notify folks if there's a significant change to numbers. If 10 more kids show up, me as the parent would want to know, well, instead of 6 kids, now there's 16. We know we'll have places where we'll have to quarantine folks, and as Mr. Weaver asked early, they move back to virtual until that period is over. Likewise, if students want to leave to go back to virtual, we don't necessarily need 2 weeks notification for that. It happens throughout the course of what we've been dealing with. But it's more for planning to have students in person that we need that time.
Ms. Battaglia?
I was going to ask that a little bit later, but I mean, you had brought up, when they start changing from virtual to hybrid and vice versa. One thing I was seeing some conversation on in emails was parents asking if you open 4 days and I only want my child to go 2 days, is that something that's an option for them? And I think that definitely has to be one of the discussions we have, because it's either you're going to be one or the other. I don't think that one option potentially could be available to just pick 2 days.
That's correct. We said 4.
Yeah, the option of going 2 days a week really doesn't make sense under this plan, because the reasoning for 2 days a week was to get that extra social distancing. And if we're going 4 days a week, even if someone wanted to go 2 days a week and not the 4, there would be no upside to that, because all of the students who want to come back would be coming back all 4 days a week. So the 2 day a week wouldn't offer any benefit to the student. And what it would do is just add another layer of complexity on for the teacher who is already trying to teach students in the classroom and at home at the same time.
I absolutely agree. I mean, that was just something that I was hearing, and I was like, that's really hard to tell a person. I'm sorry, but it's either going to have to be one or the other. It can't be jumping, is what I would call it. You can't be jumping from, you're going to go 2 days this week, and then the next week you're going to do another 2 days. Like there's just something that it has to be consistent on, in order for also the contact tracing to work in the best way possible as well.
Okay, I see no more questions, then we can go forward.
Okay, board members. So since we last met, the motion was that we would look at how it is that we would bring back CTC students 5 days a week. And what we've done is we've had high school director, as well as the principal, as well as our content supervisor, all working together over the past couple weeks to figure out what are the potential implications and insights that we'd like to share with you this evening. So at this time, I'm going to turn it over to Bill and Betsy to provide you with some specific information. If there's any additional questions, please feel free to ask them. Bill?
Okay, thanks, Jason. So what we've been seeing in the tech center in hybrid, so currently, is an average of 270 to 300 students. And so if we increase to 5 days a week, we would be effectively doubling those numbers. So you're looking at 600 students would be coming to the tech center each day. If you'll recall, as we went down the path of determining the need for expansion of the tech center, one of the issues is many of the classrooms are very small. And so if we go to have 600 students in the building, there are many classrooms where, in effect, we wouldn't be able to do any social distancing at all. So we would have to look at ways that we can mitigate that. In many of the construction classrooms, the desks are immediately next to each other. So if we were using every desk, the students would be with no distancing whatsoever. Things that we could do to look at that is alternate student time with the shop and in the classroom, but that's going to require additional staffing for coverage of the students. So those are things that we see as considerations. Another thing, currently students are not eating lunch in the cafeteria. They are spread out throughout the building eating lunch in the classrooms. But with that number of students, we would probably have to utilize the cafeteria, which would then bring students from the various programs together and also would have a distancing implication. So that's kind of the opening thoughts. And I don't know if Betsy, if you wanted to add to that.
Sure. So we would definitely have to use the cafeteria, and we're looking at 5 lunches beginning at 10:30 in the morning, because we have students who leave the tech center at 12:15 to get back to their home schools, as well as between 1:50 and 2 o'clock. So we don't have until 2:30 to feed students. We would have to use the cafeteria tables, and getting 6 feet apart between kids at the cafeteria tables when we're running even 5 lunches. We're still looking at best 2 to 3 feet between students. And if they're eating their lunch, their masks will be off. So that's a great concern to us. The other major concern is Wednesdays. If we remove Wednesdays from being virtual, not only is transportation a huge concern, but students will be in their classrooms elbow to elbow for the theory part of their program. Right now, Wednesdays, our instructors use that time to teach the theory so that once students are in the building, they can immediately get to the hands-on piece.
And to add to thoughts about, talk about having the students together in the cafeteria, just a reminder that contact tracing then would impact all 7 high schools if the students are mixed together in the classrooms or the cafeteria. So it's going to be an increased effort in contact tracing as a consideration.
Yes, and instead of narrowing it down, so far we've on the rare occasions where we've had a student who tested positive, we did the close contact tracing. There have only been a couple instances where other students or staff members were considered close contacts. If all the students are together, it will more likely be that we're closing down entire programs for 2 weeks, which is detrimental to the students and their skills and attaining various certifications if they're not in the building.
Thank you, guys. Board members, are there any questions for Bill or Betsy at this time?
Mr. Kyler.
Yeah, and I don't know, and I don't know that the board should be involved at what level, but, and I tend to oversimplify, I know that. If they're eating now in their classrooms, and there's gonna be double when you use the cafeteria, they can't still eat in their classrooms? You can't split them up? Is that just too much logistically?
Well, the issue, Mr. Kyler, is that we also have to provide for a duty-free lunch for the teachers. And so while we can have instructional assistants or other staff cover some, if we have to use all of the time from 10:30 on as lunches, we run into a staffing issue.
And then also, you probably have some classes that it's relatively easy to only let half be in the classroom at a time and half be in the shop, but then there's other classes that are more classroom intensive that's going to have to be harder to do, isn't it?
Well, I think both scenarios are tricky. If we allow half the kids in the shop, half in the classroom, then we need more supervision, because it would only take a blink of an eye for a student to be seriously hurt using some of that equipment without proper supervision.
Right, and so that's an issue also when we talk about having students be both virtual and in school at the same time. If the teachers are in the shop supervising their students, then they are not on the computer interacting with virtual students. And so that's a consideration as well.
And if I could chime in, as the person that pays close attention to graduation requirements, etc., if a student in some of these programs opts for all virtual, they could be putting their opportunity to earn their certificate in jeopardy. It could almost be impossible for that student, which obviously is a major concern, because at the point that they get into these programs, being able to do something different at their home school to earn their graduation credits in a program that's approved would be extremely problematic for that student.
Thank you, Mr. King, for bringing that up. I just know how important it is for these students to be hands-on 5 days a week. And I just think it's been very negative what we were just reported to. And we need to get that fixed.
Yeah, I guess I'd like to understand.
I don't understand.
What do you need from us, right, in order to, how can you make it happen? And what do you need from us in order to knock down those barriers?
I would suggest that one thing that would resolve some of the issues is retaining Wednesday as a virtual day, so that teachers could do their theory lessons on the Wednesday without the students packed into the classrooms, and then focused on their hands-on skills on the rest of the days, without having to worry about trying to monitor students in both the classroom and the shop at the same time.
Okay. I think that makes sense, right?
Another bigger picture conflict for us is many students will need the bus service to get to Career and Tech if it's open on a Wednesday, which would require supervision at the home schools for many of these students, which also could include the need for a nurse. So we would be eroding the virtual Wednesday model at the comprehensive high schools as well if Career and Tech's open, because by proxy, they're going to need to be open to some extent for those students who may only be there Mod 1 or Mod 4, et cetera.
Mr. Kyler?
So, Ms. Savigny asked what you need, and I think the answer was maybe stay virtual on Wednesdays. What's the downside of doing that? You just told us why it's better to stay virtual Wednesdays. How does it hurt either the students or the staff if they do that?
I don't know how it would hurt the staff because they're going to have to do the theory lessons at some point through the week anyway. So, I guess you could be looking at, if they're doing a portion of each day with the theory piece and then transitioning to the shop, that would allow for, more movement of students back and forth instead of having the theory concentrated. But I think the benefits are going to outweigh the negatives there.
Yeah, Bill, if I may also add to the question, if that Wednesday was remained a virtual day for theory-based instruction as it is now, if all students did come back Monday, Tuesday, Thursday, and Friday, half the class could be working asynchronously in the classroom while the teacher is supervising students in shop. However, it still would require an instructional assistant or some sort of monitoring adult in the classroom to make sure students are safe and being attended to. So I do think that would be a major step in the right direction in regards to being able to manage this. Betsy, I don't know how you feel about that.
I'd like to say something. This negative presentation, we have strived to get our kids back in school and work really hard. Just tell us what you need, not say you can't do this, you can't do this, we can't cover this. Just tell us, just think of things that we need to help you with so that we can do everything that we can get that Career and Tech going and solidify, because I know they really need to do hands-on. Dr. Lockard?
Right.
We want to help.
Respectfully,
Yes.
no one's trying to be negative. We're trying to point out what the challenges are in front of us. And we want you to be fully aware of what those challenges are so that as we encounter them, everybody is clear about what they are. This team's been working extremely hard to try to figure out what do we do with that. Aside from building another building in the next 3 weeks and finding 1,000 more people, we're trying to figure out, well, how would we do that? So, the intent is not to be negative. The intent is to be, here's what we're facing. And I feel like, I think the team presented one thing for consideration, but they would share with you what the answer is if they knew what it was. Right. And that's where we are right now.
Well, it sounds like Wednesdays, we might need to change that. And we will do what we need to do to get things right. Mr. Kyler?
Yeah, I was going to say, and I recognize, and there's a big difference between negative, positive, and just being realistic. And I appreciate realistic. And that was my question for the Wednesdays, was because it sounds to me like we need to say Career Tech probably ought to be 4 days, but I wouldn't want to hear April 1st, man, it's really screwing us up not having Wednesdays. These guys aren't going to get graduation credits or whatever. So if you guys think that's worth it, and then my next question would be transportation with all this. I can see where the transportation, it really helps to coordinate high schools with Career Tech. Is that the same way with Gateway and Carroll Springs, or are they a little different and you can work that out?
They're different, and we can work that out. I'd ask John or Mike if he's on.
So making this decision doesn't hurt them in some way, correct?
Correct.
And if we need to change that Wednesday,
Yep.
so be it. That, to benefit everyone, I want to make it right. Mr. Weaver?
Having taught in that situation for years,
Absolutely.
the liability is tremendous. And that teacher cannot leave anybody in that shop, especially with equipment, not, had fire, electricity, and everything else going out there. That was heavy liability. I couldn't leave students behind. And if you do, you're going to have supervision for that, which is going to take quite a few people, and you just can't leave them with anyone. I mean, in these situations, you have to have good staff people to help with that, and it is a tough situation, and the liability these guys are under is tremendous here. I mean, if a kid, an accident, one, missing body part or anything
Yes, I
happens,
know.
it's tremendous. So you have to really listen to what they're telling you, and they need people if you're going to do something like this. I think that's the biggest thing I'm hearing.
All right, Mr. Kyler?
So if we say career tech's 4 days a week, is there still, I had asked the one question about the different classes. Are there some classes that are so classroom intensive that it's going to be harder? Or do you think, like Mr. Anderson said, given that Wednesday, which gives more asynchronous time during the other 4 days, does that help you solve that? Or are there a couple classes that it's going to be hard?
Well, I think what you're going to see is that, the shop heavy classes, as I call them, your construction, your transportation classes, are going to have to take different strategies toward it than a computer-based class, like our Cisco networking. It is going to look a little bit different. But we also find that with the computer-based classes, we were able to set up solutions so students could do more of that work from home. So I don't think having those students on a virtual Wednesday, I don't think they lose anything by it. And it gains, I would say, because I'm trying to be realistic and not negative. But when I would say having the Wednesdays be a virtual day so that teachers could focus on theory instruction, that gives the positive benefit of focusing their shop time so that the teachers can be truly focused in there and get the students their hands-on instruction. So in my mind, it actually is a positive, even if it may have sounded negative in presentation.
Well, realistically, I like that word better. How many teachers or how many people would you need to monitor a lunch shift in that cafeteria to help out during, like the 5 lunch shifts? How many people would that include? How many, do you need to have 3 teachers there? Do you need to have 5 teachers there?
I'm not so concerned about lunches because the assistant principal and I are in the lunch shifts.
Okay.
My greater need would be supervision within the classrooms if we have students in classrooms as well as students in shops.
Okay.
So it sounds like if we made the one change that
would help out a lot.
That career and tech would be 4 days a week, and that Wednesdays would be primarily virtual theory-based instruction. So it wouldn't be like a virtual Wednesday model where kids get a chance to catch up. It was going to be theory-based instruction for career and tech on Wednesdays. That would go a long way to making this possible.
Yes, and Wednesdays for career and tech have been theory-based all along.
I don't see a problem with that, ladies. Mrs. Battaglia, Dr. Dorsey,
No.
anything to help out.
Right, and I just certainly wanted to thank Mr. Eccles and Mrs. Donovan for sharing the challenges, because again, we come up with the what. You're trying to share the how and how it's going to all work, and I hear that there are certainly challenges, and when we hear about the challenges, we need to try to address them to see if there's more that we can do concerning them. Now, when the weather gets nice, and I know this is certainly going down the road a bit. But are the students allowed to eat outside at all? I mean, even with that, is that an option for some of your lunch shifts to take care of some of the social distancing?
We do have a courtyard where some students eat. However, with construction, allowing students outside gets a little tricky.
Okay. Okay, so again, so if we would keep Wednesday as a virtual day for you, you would still have some concern, certainly with the social distancing in the classrooms, and the other concern certainly was the supervision for those students who had shop and also classwork.
Yes, that is correct.
Again, I think this
So
would be.
I'm sorry. I was gonna say, was there a proposal date? Because we had said, with the phased-in approach, that career and tech would go first. Is there a proposed date in terms of, so if we were to say that career and tech was 4 days a week, when could we execute that?
Or should it coincide with high schools again because of the transportation? We want
That-
everything, but we
That,
want to be realistic.
that would be my recommendation.
Yeah, okay.
I'd look to Ms. Donovan as well.
That would be my recommendation.
I agree as well. From the high school program perspective, that would be ideal for us to all return to the 4 days on the same day.
All right, and maybe I'm missing it. Can you help me understand why transportation between career and tech and high schools, why it would need to be 4 days for a high school versus career and tech on the same day?
Sure, and Mr. Hardesty, certainly welcome to give you some specifics, but many students will need a bus from their bus stop to their home school, and then the career and tech run will have to take place. Students that don't have access to a car, they can't provide bus service directly from door to career and tech, so that has to be based off of their home schools, which is why there would be supervision required mod 1 and 4 at the home schools. And then again, Mr. Hardesty can talk specifics, but matching up the schedules, because career and tech is such an integral part of the whole high school program for the whole county, makes this so much more efficient and just honestly more reliable as well.
I guess I don't understand, though, why the high schools have to be, I mean, if you're having the buses are running all of those days, right? So it doesn't matter whether the high schools are there 4 days versus career and tech, because all of the bus routes are still running all of those 4 days.
But some of the kids wouldn't, is what you're saying. If high schools were still cohort A, but career and tech's all 4 days, the B kids aren't there to get on the bus. Is that what you're saying, Mr. King?
So no, the bus run, and again, I wouldn't let Mr. Hardesty to chime in on that, but to get the home to the home school bus run is the key to this beginning. And then the bus runs from the home school to career and tech are not as complicated. But if that first run doesn't occur, then there's high school students that aren't able to get to career and tech.
But what runs aren't occurring? Like all bus routes are running the same every day. It's just a matter of whether they're picking up the A cohort kids or the B cohort kids.
The way the current routes are for career and tech is we run our regular high school routes, and those students that are attending career and tech will get off the bus in the morning at their assigned high school and then take a shuttle bus to the career and tech center. So the issue for Wednesdays is that students aren't at the career and tech center for the full day. They're there for different mods, and therefore the remaining portion of their instructional day has to be handled at the high school. And so that's a staffing issue for the high school. This is not a transportation issue, because we can transport in that fashion, picking up students along our high school routes on a Wednesday. Any student that's at the bus stop, we will pick up, but we have to take them to their assigned high school. and then shuttle them back and forth during the day to and from career and tech in the high school.
Right, but we already said that we're not going to require the Wednesdays, so that issue should go away, right?
For Wednesday, yes, and for the other days, it'll just run as it normally would in a regular school year, as we're doing now for A and B days.
But Mr. Hardesty, if I understand right, what Mr. King's saying, if Career Tech starts a week ahead of high schools, you're gonna take the A kids to their high school. Career Tech wants to get the A and B kids and take them to Career and Tech. The B kids aren't there. We need to open high schools and Career Tech the same day because of how they get back and forth. Does that make sense?
Well, there wouldn't. I think what Mr. King is saying too is there may not be staff at the high schools because there aren't students there to, what are the students going to do during the day that they're not at Career and Tech? So when high school starts, it will be fully staffed and classes will be fully staffed, and therefore there's classes for these students to attend during the portion of the day that they're not at Career and Tech.
So wouldn't it just be so the kids that go to Career and Tech, they would just be in a 4-day for their other classes sooner than the rest of high school, right? So even if high school is staying on the 2 days, so you have an A cohort and a B cohort, if you go to Career and Tech, you're now part of both the A and the B cohort. So it would just be a slight difference between how the Career and Tech and how the non-Career and Tech high school students.
But for a week or two, is that creating a complication that maybe isn't worth it?
If it's only going to be a week or two, then I would say
that's all it
it's
could
not.
really be, right? Till you get approval, until it could be the 15th instead of the 22nd or something, and that's what I'm afraid of. It's just one more complication in something that's complicated enough.
Right. I mean, I thought we were saying that Career and Tech was one of the first priorities that we wanted to get them in. So I thought that there was probably going to be more like a 4 to 6 week differential between them. But it doesn't look like we're ready to go with Career and Tech yet.
So I think.
Well, and I think the piece that we missed is that, again, the Career and Tech is just a part of a student's day.
Yes.
So what I'm hearing is, okay, then what's going to happen to them, the other part of the day?
And that's true, because in a student that goes to Career and Tech, they either go 1 through 3 mods to Career and Tech, and then have a 4th mod of last day. The last mod of the day, they have to go to class at their school. Then the other group has a class first mod, and then they do 2, 3, 4. I think that's what you're all missing. That they all have one class at their home school every day, and that's where we don't have coverage.
Mm-hmm.
No, but we do have coverage. The teachers are there, so it would just be the Career and Tech students. You guys are making this more complicated than it needs to be.
Oh, I know.
I'm talking about
There's already a teacher there, and so if you're a B cohort Career and Tech, if we're saying, and your Career and Tech, you would just go the A and B cohorts. And so even though the non-Career and Tech high school folks, you would only have the A cohort there. So the B cohort would join the A, and the A would join the B if you're part of Career and Tech, right? And so the teachers are already there. You don't need additional coverage. The teachers and the partial student groups are already there.
So, Ms. Savigny, if I may, to reiterate what you're saying is that if you are a Career Tech student, you would begin 4 days sooner than any other student.
Than any other high school student, yeah.
Any other high school student.
But realistically, if we're sitting here on the 24th, let's say you guys get this all submitted to the state Monday the 1st, that's only 3 weeks from the 22nd. So, even if we bump them up, I think we're making it very complicated for gaining a week or two.
Yes. Devanshi, you had your hand up. You got missed in here because your face, you weren't here. Yes, you're on.
So I've been talking and hearing from some career and tech students. Some of them are immunocompromised, or if they are a bit uncomfortable with a 4-day going in person. And Mr. Eccles, you mentioned that that there is a significant disadvantage to those virtual students in this 4-day model. So what will be done to help them? Because I think that also needs to be addressed, because I think that that's a really big equity concern with that.
Well, that certainly is a challenge, because as we require the teachers to spend more time and attention in the classrooms and shops that are in front of them, they are obviously not at the same time spending that attention on the computer to assist students that are at home. So that's where we would want to look at, can we get additional staffing to have, in some cases we have, instructional assistants or, the building permanent subs who assist with, providing connection to the students that are at home. So they're not providing the instruction, but they're making sure that they have materials, they're answering technical questions, they're making sure that those connections exist. So additional staffing of that nature would assist with those fully virtual students.
Board members, any other questions in regards to CTC?
So is the recommendation that career and tech would go 4 days a week, just like the high schools, and they would start at the same time as the high schools? I still think that it's not an issue to start career and tech earlier as part of a phased-in approach. We talked about using a phased-in approach. That would be one piece of the phase-in, rather than trying to make everything happen on one day. Ms. Battaglia? Oh, I'm sorry.
You're fine. I was going to get
Yeah, I think that goes along with the phased-in approach. It gives that little bit of a staggered opening in different age groups. I had said about ESOL, the 504s, the IEPs, special education, and career and tech. This kind of gives that little bit of a stagger, so it's something that you get kind of used to. It's like, okay, we're going to put this in place, so we got to get used to this a little bit. And then you potentially move forward with a little bit more. So it's not, the career and tech kids aren't waiting, but we're also putting in place something just a little bit at a time. So this is a part of that. And yes, it's the high school kids that are going to be going, some are going 4 days, but it's no different than some of the teachers' students who are already going 4 days, correct? Like we have that offered. So it just kind of opens it up a little bit at a time. And I think having career and tech students go the 4 days, I think it's an advantage, and it is part of those staggered steps.
You're saying to have them go earlier?
Have the career and tech kids go ahead and go at the same time with the staggered steps.
Yeah, my vote would be to start them the same as the high school. I think the phasing would be special needs kids, which some started this week.
Yes.
You're doing all that. This plan gets submitted the first week of March. I think at best, career tech would be a week earlier, where you're proposing elementary be a week earlier, which is a whole different age group, a whole different group of transportation. I still think it's going to be hard enough for the career tech has to reach out. The high school principals have to reach out. Who's coming 4 days? Who's doing that? And to have the high school still doing A and B for even a week or two while career tech's doing everybody. I just think that's a complication. And I'd love to see them there tomorrow, but I just think that's a complication that isn't quite worth it to gain a couple weeks.
Any other comments? And we will have to do, Ms. Taglia.
I guess I'm kind of confused by where you're saying like it'd be a complication. It's no different than having LFI high school students come in or teachers and their students coming in the 4 days. You're just staggering in another age group into the high schools, and then you open up a little bit more. It's kind of like the same as like an invitation for those who need the extra help. You know, we have students in sports, so I'm kind of confused on why would that be different? I mean, if you have kids that are doing sports and they're in high school, if you're just bringing in a smaller population, I mean, it's not.
Mr. Kyler, you had your card up.
Again, my opinion, Career Tech, I think you said was 600 kids. So, oversimplifying, on the A day, only 300 of them would be there at the high schools. So now you want to send 300 more just to go to Career and Tech and not do, what do they do the one period they do at their high school when they get back?
They would take the class that they normally take.
But they would be Bs with the As and As. I just think it's, we're a month away from the 22nd, and I hate to see us rush something and make it more complicated than it has to be. I think we're already doing something that isn't easy, but that's my vote, I think, at least, guys.
Ms. Savigny.
And I agree with Ms. Battaglia on this one. I think it's very similar to, we've got some kids at various levels who are already in 4 days. So we've got some of our ESOL kids, we've got some of our special needs kids, we've got some of our teachers' kids that are in 4 days a week. This is just adding on to that, right? Like, so some of them are there 4 days a week. The majority of them are there 2 days a week, but there are some that are there 4 days a week. And I think that we're talking about 300 kids spread across 7 different high schools. So it's about, 50 kids per school. It's not much different than the exceptions that we're making to have some small groups of other kids there 4 days a week. So I view it very similarly to how you are, Ms. Battaglia. And I think that 4 weeks in the terms of career and tech education is a big deal. Like, if that was something that we were able to execute by Monday, right? Like, do career and tech 4 days a week, have them come in, but we can't do high schools until the 22nd. I think that's a big deal. It's a pretty long length of time in terms of the amount of in-person instruction that the career and tech kids get in their programs. So if it's a difference of a week, I agree with you. If it's a difference of 3 to 4 weeks, get them in.
Any other comments? All right, Mr. Anderson.
Yes, ma'am. So just for clarification, when we submit our plan, we are going to be submitting for 4 days a week. And as soon as it's approved, then we would like to transition CTC students to on-site learning across the board in high school 4 days a week. Is that correct? As soon as we can.
I think the Wednesdays are set. I'd like to see us get to the end and talk the whole phase in.
Talk the whole thing.
Yeah,
Okay.
talk realistically.
Right. So let's talk about the rest of the
What's the
phase.
soonest they could really happen? What's the soonest elementary could happen? What are we giving up if we're doing this piece or that piece?
Understood.
I don't want to complicate it any more than we have to. So
Okay.
I think look at the phasing at the end. Is that okay with everybody?
Sure, absolutely.
It's okay, but can,
Dr. Dorsey.
again, so if we do the CCC, TC kids, or students, 4 days, when they're in their home school, they'll be with the A cohort
And the B cohort.
on Mondays and Tuesdays, right?
Mhm.
And then with the Bs on Thursdays and Fridays.
Right.
So now how do the teachers in the high school structure their lessons? I mean, on the
No
B
different than it
days,
is
on the B days, are those students getting what the A students had on Monday and Tuesday, or are they all moving forward?
No, I mean, so when the teachers are teaching the classes, they've got A cohort kids in their classroom, and the B and the virtual are online watching the same lesson. same as to the flip is true on Thursday and
Yeah,
Friday.
Friday.
The B cohort kids are there, and the A cohort and the all virtual are watching those same lessons. So it's
So
just,
it's not going to be any repeat of
Should not be.
in-school or in-class activities on Thursdays and Fridays. It'll all still be new material for them.
Okay.
Okay, so Mr. Anderson, we have the 4 days, and then we'll finish up the rest of it at the end then.
Yes, ma'am. And I appreciate the board's discussion there. In no way was that to be intended as to be negative. It is a very complex situation. We are working and doing everything we can to make sure that we make this happen, and we will continue to do so.
And I do understand that. I just, I want the students to do well, get in there, and we just got to figure this out. And,
Yes.
and it's a reality. And,
That's-
and I should have maybe used another word, but I'm just.
That's okay.
Yeah, but it's just like, we got to get this fixed.
Yeah, and we will continue to work at it. We will continue to work the problem until we have the solution. Board members, we're going to move into staffing, and I'm pleased to share with you that this week, I want to commend the special ed team and commend all the schools where these specialized programs are taking place. As Mr. Kyler said, this week, we reintroduced 5 programs in 13 middle and high schools, specialized programs. And Mr. Shockney is out on medical leave. He's recovering from a surgery. But this evening, Christine Bechtel is here with us. And she's going to talk a little bit about the special programs implementation that we've started this week and how we have a plan to continue to transition over the next couple weeks. And then if you have any other additional questions as it relates to special education, I know Ms. Battaglia has mentioned it several times, our team is here to answer any questions. So Ms. Bechtel, would you like to talk a little bit about our progress this week and then what we look forward to over the next couple weeks?
Sure, absolutely. Good evening, board members. So as Mr. Anderson just shared, we had several special programs that started 4-day in-person instruction this week. We anticipate adding more programs to that each week as we progress toward March 22nd. So we also are prepared to have Carroll Springs take part in in-person instruction 5 days a week when they are prepared to do that later in March, as well as some of our transition connection academies.
Now, is there any way we can help Carroll Springs out, just like we've helped Career and Tech out? Because I know, with the social distancing, we do have a lot of students. So what can we do to help that school?
So I think more of the concern with Carroll Springs is the population of students which that school serves. The Learning for Independence students which attend Carroll Springs attend there oftentimes because there's a physical or medical component to that. So the Wednesday has served more as a cleaning day, as it has for all schools. So absent of that, there's a concern with 5 days because we're missing that deep cleaning day where students who are medically fragile attend. And I honestly, I don't have a thought on how to mitigate that concern.
So, members, as we're looking at that, I know we have a lot of students there. Is that something that you want to also consider on a Wednesday? Because there are a lot of students there. So I'm throwing it out, to help anything out we can do to keep going forward. Dr. Lockert, do you have any opinion on that?
I share I share the concern that Christine just did as it relates to medically fragile students, and making sure that the proper precautions continue to be in place. Ms. Rockefeller would be the person that probably would directly be able to tell us, this is a group I'd recommend 4 days a week because of medically fragile conditions. But she does have some, and Christine, there are some that are going to be going 5 days a week or are going 5 days a week that I don't know that she'd have the same concern with.
Well, that's why I brought this up, because, it's important that, in that school particularly, we want to help out, whatever, in all of them, but I do know that school needs to be cleaned. It's a different situation, it's a different setup, we just need to be safe. So does anybody else have any comments about that one? Ms. Pataglia?
I was just going to agree that that was something else I had heard in an email that, they would appreciate if we could offer Wednesdays still virtually for some of the different groups, because that is a needed day to make sure that things are taken care of properly in the schools, to have that deep cleaning or getting materials
Right.
ready for the next couple of days.
Mr. Kyler, Ms. Savigny?
I'll defer to the experts on that one.
Yes, me too.
If
If
Wednesday-
you all think that we need Wednesdays for deep cleaning and doing the right thing, then we need to do that. We really do, Dr. Lockhart.
Well, I appreciate that flexibility. Like I
Yes.
said, I think Ms. Rockefeller would say to you, yes, there are groups of students that would be advantageous in a support. I think there's also probably a group or two that she will be able to run 5 days a week, and I'll support that as well. So thank you for
So
that
there we go. There, we'll
discretion.
take care of that.
So Carroll Springs is 4 or 5 depending on which
Depending
group
on
of
the
students.
individual
Depending on the
student.
program,
That makes
correct.
sense.
Right.
That
That's
makes
good.
sense.
Good. That's a big positive step. I like that.
President Herbert,
Go ahead, Mr.
President
Anderson.
Herbert, I'm sorry, President Herbert, thank you very much. Christine, thank you very much for that report. And board members, I know Dr. Lockhart has shared our plan as it relates to continuing to integrate and bring in more students through the specialized program. And we'll continue to work those programs to continue to augment all the instructional programming that's taking place. As we're looking now at classroom coverage, I do know we started having conversation around that. I do want to commend the central office staff at large for their outstanding efforts and continue to support our schools. And I also want to thank the schools for their leadership in making it happen, our building level administrators. I'll kick it back over to Cindy or John if they want to have any more specifics in regards to classroom coverage. But I will say that I appreciate the board asking what it is that we need. I think once again, we're finding ourselves in a position where staffing is paramount. And I'll speak specifically to special education staffing, where we're continuing to do our best and working night and day to recruit and to hire student support assistants and instructional assistants to make sure that we continue to provide the most robust instructional environment for all of our students. So I'll leave it there, Dr. Lockhart.
Thank you. Any other feedback from the board before we move on?
No, I think we're good.
We will return to staffing for just a brief glimpse in a second, so there'll be one follow-up on that. Hopefully the slides are advancing again. Mr. Singer, to some extent, stole my thunder on the next couple of slides, but you had a conversation, at least initially, briefly, about the new CDC guidance relative to social distancing. Dr. Lockhart had mentioned at the beginning of the meeting that we certainly wanted to be aware of this. We certainly wanted to have full transparency, and so the next couple of slides were intended just to note the CDC guidance, to take some excerpts. So what's on the screen? There was no attempt to, this is not everything that the CDC has to say word for word on social distancing. We just tried to identify the 3 sections of the operational strategy, the new operational strategy where physical distancing is referenced, and pull out some excerpts that we believed were sort of the theme of what they were getting at. Not going to read these to you. It's available to the public, and certainly I know that all 5 of you are familiar with it, but this was these 2 slides were meant to just be a place where we could note the new guidance, because it is one of the substantive areas that are being changed, and then make some concluding remarks relative to physical distancing. The next slide, which I advanced, this actually is the language that Mr. Singer had on the screen when he had the blue, green, orange, and red chart up earlier. These are the excerpts from that chart, plus a footnote that goes with that chart. And then lastly, I think this is a point that maybe Mr. Kyler might have mentioned early on. Something that everyone needs to bear in mind and understand is that the CDC guidance is a set of recommendations and not regulations. That's a point that was made on the CDC USDE webinar that Mr. Kyler referenced earlier when he was speaking. And so, what I heard one of the CDC representatives say in that webinar was, these are our recommendations. They're meant to be considered at the local level, at the jurisdiction level. But you also must consider them in conjunction with your local guidance or state guidance, with your data, your metrics, and with other factors that you need to think through. And so I'm going to conclude with, in terms of our presentation, our final thought on physical distancing is something we kind of led off with when we began this conversation. Under the revised plan as it's being presented to you tonight, essentially what we're saying is we're going to do the best we can in every situation to achieve that maximum amount of social distancing, whether that's in a classroom, a school, a bus, a cafeteria, wherever. We're going to do the best we can. That will be somewhat largely dependent on the number of students who return for that school or that program. And we'll do our best to inform parents and families as we understand that information going forward. That is something we're going to touch on one last time before we conclude here. Staffing challenges, I think.
Mr. O'Neill, before
hold
you
on.
before you go on from there, I appreciate that information and that perspective, and I had some questions about the actual reopening plan and the way things are worded with respect to social distancing. I think now is probably the time to bring it up because we were just talking about social distancing, but there's 3 different locations, and it's on page 42, 43, and 58. Does it make sense to go to the first of those, maybe on page 42?
Sure.
Under considerations, there's a statement here. It says, students will be distanced from each other as much as space allows. And then it says, however, when operating with schools open for all students in person 4 or 5 days per week, strict CDC social distancing guidelines cannot be practiced in classrooms, cafeterias, or other school areas. I don't think that's how we want to say it, because there are many places where it will still be possible. There just will be some where it isn't possible. Right? So, shouldn't we just say that social distancing will be practiced to the greatest extent possible, which would be consistent with the CDC guidelines?
And we need to change that on which pages? 42?
So it would be
that
42, 43, and 58. So there's 2 instances of it on page 43. So page 42, 2 instances on page 43, and then page 58.
I'm sorry, Mrs. Savigny, you said 58 for the last one?
Yeah, the last page was 58?
58.
58, Mr. O'Neill.
I got it. So they repeat. That's the same language each time.
Yes.
Right, it's the same language, just in 4 instances.
Gotcha. So we would be replacing that language to simply say social distancing will be practiced to the greatest extent possible.
Right. Are others in agreement with that?
Yes.
Okay.
I want to be positive.
Marcia.
Mr. Kyler, sorry.
And along with that, and the social distancing, because that's obviously a lot of the community's greatest concerns. And I know some of us get questions on how many desks in a classroom or whatever. Dr. Locker, can you make it how you'd prefer it to be for parents? If elementary schools are opening March 15th, they've done their surveys, I'm concerned, how many is on my child's bus? How many is in the classroom? Who do I contact? What's the best contact method to follow that up?
Right, so Cindy and I had talked a little bit about this. As opposed to everybody contacting to find out, we're trying to work on some way that we can let people know this is what's going to be on your bus, this is going to be what's in your classroom. Like I said, it's a little more challenging at the high school level, but that's, as opposed to everybody calling in, we'd rather push that information out to parents. So
That's a great idea.
Right.
That really is.
So we're working on that.
Yep, okay. No, thank you. I wanted everybody to hear that, hopefully, because I know they're concerned, but like you say, everybody calling doesn't get the answers quicker. So thank you.
I think it's going to be hard for some people to make a decision about when we ask them, do you want to send your child back 4 days a week? It's going to be hard for them to make a decision without knowing
Yep.
how many people are coming back. So that's a challenge as well.
Okay, even without knowing the number that you're expecting to come back, could the parents sort of be given what was current? Currently, we have X number of students in cohort A, X or Y in cohort B, and maybe they could just use that
We
and
could
sort
at
of
the
gauge.
Yeah, we could. I don't know if that translates, like I said, at the secondary level, because you have 30-some%, whatever Cindy had mentioned earlier, doesn't translate to 30% of the kids in my class necessarily. It's class to class. So we'll work on that, Dr. Dorsey. I hear what you're saying. We want to give people something, obviously, to go on, and then we want to try to provide some more concrete numbers as we approach those dates.
Mr. Frazier, I saw that you had your hand up.
I did, thank you. First, I have to apologize for being late, but I had another meeting just prior to this one. But from what I'm hearing right now, like I said, I wasn't here at the beginning. So social distancing is 6 feet or more is only going to be done when it's possible to do that, and if it's not possible, students will be closer than 6 feet or more. Is that what we're saying right now?
Yes.
Because to be frank, I think it was last Thursday, I just had a conversation with Dr. Salmon, and she's pushing, of course, to have schools open and have students back in as fully as possible. But my conversation with her was 6 feet was the minimum that she wanted to have there, along with the hand washing and the mask. So I'm just wondering how we can change that our document, I guess it is, what we're putting out, and I guess it's going to have to be approved by her anyway, so she'll see it. But from my conversation with her, her understanding is 6 feet minimum, but we're not doing that, is what you're saying.
Mr. Kyler, did you want to say?
Yeah, that's not what CDC says,
Yes.
and
Well,
I guess
I didn't say that's what CDC said. I said I had my conversation with Dr. Salmon last Thursday, and that's what she told me. That's what we discussed.
okay, and we need to get started here. If I'm not going to get to say a complete sentence, then I won't raise my card and talk. So go ahead, tell me when you're done, and then I'll talk.
Give me another 5 minutes, and I'm done. Go ahead.
All right, we're going to move on. Ms. Battaglia?
I was gonna say, I think it's always said 3, they would like 6 feet. I think that's what they've always said, is they would like 6 feet, but it's never been, that's what you have to have. It is always, to the extent at least. I mean, you could do the 3 to 6, but it's never been really said that it had to be 6 feet, if I remember correctly.
Ms. Battaglia?
Yeah, I think it's they say 6 feet is a recommendation, but it says to the greatest extent possible, feasible, and practicable, I think is, some of the language that's in there. And honestly, when we came up with our first hybrid plan, we were assuming that, we were splitting into A and B cohorts, assuming that everyone would come back to in-person, so that 50% of our students would be in A and 50% of our students would be in B. And there were some situations where 6 feet couldn't be achieved, but we said it was to the maximum extent possible. We understood where those situations were, and we made as many accommodations as we could, right? Now we're saying, well, about 50% of the kids are coming in. So it's no different from what we had planned early on, with 100% of the kids coming back and 50 of them being in each cohort. Now we're basically saying, well, it's going to be 50% of our kids on 4 days. So it's the same situation, the same issues that we were dealing with early on.
That's correct. Devanshi?
Well, I absolutely recognize that at the elementary and middle school, we're really over near 50% of the kids. I really want to talk about the high school level specifically, because we're at like 34% attendance in terms of hybrid. And I've mentioned before that many students and families are just now becoming more comfortable with going into hybrid after the second semester started, or even now just seeing that the case numbers are lessening in the community. And I just think that if our goal is to have the most amount of kids experience in-person learning, then that won't necessarily be achieved by a shift, is the point that I'm bringing up, because there will be people who will be a little uncomfortable with going straight into a 4-day week.
Ms. Savigny?
But so the fact that there are only 35% of the kids coming in at high school, they're going to be inherently more socially distanced, right? So there should be less of a concern at the high school level.
Yes.
Because they're not even at the 50% level.
And they can come in now in hybrid anytime and try it. Dr. Dorsey, did you want to?
No, I'm just shuffling
all right.
papers.
Any other comments? No.
Your mic.
I don't think your microphone's on.
I'm looking at the COVID guidance for Maryland schools, dated January 27, 2021. Is that the most recent?
Yes.
Okay. And it says here on page 5, as part of their reopening plans, COVID-19 prevention and mitigation strategies, MDH recommends all schools implement strategies to ensure that students, educators, and other school staff maintain 6 feet of physical distance while in the school building, on school grounds, and on school buses to the greatest extent possible. I mean, that's what they're saying here.
Yes.
To the greatest extent possible.
To the greatest extent possible.
And the CDC recommends that when maintaining 6 feet of distance is not feasible, to try to keeping as close to 6 feet apart as possible. Recognizing that the closer you are, the more likely it is for respiratory droplets to be passed between people. And then MDH requires that schools make all reasonable efforts to implement the 6-foot distancing rule to the greatest extent possible. So, I mean,
right. But
that's what we're being told here.
Yes.
Right. And everything says to the greatest extent possible.
All right, Mr. O'Neill.
Okay. Get back to my slides here. So that didn't move. Please bear with me. There we go. So one final discussion or thought on staffing. I think Jason and others did a good job of giving those specific examples, and there is some overlap here back and forth, and the conversation has been dynamic, and that's good. But we did want to try to put some data points with some of the staffing concerns that we keep referencing, and let me just say a few things up front. These are data points extracted from points in time. These numbers change sometimes on a daily basis, and so what's on this slide when it was pulled to create this may not be the exact accurate number at this very moment, but this is a range. Secondly, this isn't a new concern. This is something we've been talking about the whole time, whether we've been in virtual, hybrid, or now moving to this new model. So this isn't something that's now a concern that hasn't been a concern. It's just that we wanted to talk about the staffing picture more as a whole, to give some of those examples that have already been provided, and to make sure that everyone involved in the whole school system community here understands the, sort of the level or the breadth of what we say what we mean when we say, we're looking at these staffing concerns. I know back in the late summer, early fall, when the plan was being finalized and approved in the first pass with MSDE, we spent a lot of time at your meetings, in fact, talking about some staffing issues. And back then, that was generally a conversation about employees and teachers accessing the Family First Coronavirus Response Act leave, and also employees, mainly teachers, who were having approved accommodations and therefore teaching virtually, but not necessarily teaching in person. That was a while ago, and I'm not sure that we've done done a great job in the interim of updating the fuller staffing picture. And I'll take ownership of the fact that, I feel like I haven't done the best job of updating the fuller staffing picture. Not that, so FFCRA went away, that expired in December. Many of our employees have come back as a result of that and other policy decisions you made. Some of those employees with an accommodation have trickled back in as their circumstances, their medical situations, having had an opportunity to be vaccinated, have come and gone. So it's not that that's not still something we're working on. That is, but that's far from the only staffing concern that we're managing and trying to keep an eye on right now. What else happened is that we did, and with your approval, you gave us a great deal of flexibility and latitude, and that was much appreciated. We went on a hiring ramp up in the November-ish timeline, and initially we were very successful in staffing a whole array of positions to help provide support and coverage in schools. What has been happening since then, sort of incrementally, is we've begun to suffer some attrition in several key categories. There's many. We just picked a few to put on the screen here tonight and talk about. And so the staffing, when we say we have staffing challenges or we're looking at staffing, it's not that same conversation from back in October. And I want the public, for those people who may still be at that point in time, to know that we're talking about something much more detailed and many more moving parts than just that one thing. And so the truth is we simply haven't been able to continue to hire at a level to outpace the attrition we've experienced in many, many categories. And that's what's put the pressure on coverage and support and programs that Cindy and Jason have been talking a lot about tonight. We're still trying. We haven't stopped trying. We've tried all sorts of strategies. You've been part of and aware of all of those strategies. You've given us approval. We continue to work on those things. This isn't meant to be negative. This is meant to, the word was realistic. This is just another discussion of the staffing situation we face and how we're going to have to continue to look at this each and every day, each and every week. And this is an area where, as we do put more people together, potentially, we really will be keeping an eye on that list of staff in quarantine. Right now, that list is in pretty good shape relative to some of the places. It's not at an all-time low, but it's significantly down from some of the levels it's been at. But when that's kind of the other variable that's always out there and always giving us pause to think and consider everything possible that we can do. So unless Dr. Lockhart, Cindy, or Jason want to add any other thoughts relative to the staffing picture, I feel like they've done a good job giving those examples in the specific programs. And if not, and I can't run these slides and see you. This is kind of a weird thing happening with my computer, so I don't know if anybody's about to speak. You just have to speak. I have to look up there at a different monitor to see my slides too, which is strange. So with that, this is the last slide we have for presentation, and then certainly open to any other dialogue, questions, thoughts you have. But we wanted to conclude with some other actions that are going to be taken, that are underway, or that we're working on. I actually wanted to start. I'll start with the first bullet. I think we've spoken enough about MSDE. We know we're sending it to them as soon as we can get it prepared. We don't know for sure when we'll hear back from them, but we will stay in touch with them and do our best to get a response. There's an item that's not listed specifically here on this slide because, as you know, we have to prepare documents for your board meetings a little bit in advance and get them ready, and so that they can be published and an agenda can be set. And so sometimes timing doesn't work out so well. But there was another mitigation strategy that we're working on full speed ahead. And even though it didn't make the opening version of this presentation, I did want to mention it before turning the rest of these items over to Cindy and others to talk about. And that is, as you know, we meet with our employee units all of the time and talk about everything, but especially the operations of the schools at the moment. We also have a standing committee with CCEA to talk about concerns relative to mitigation strategies and how the schools are operating within the pandemic environment. And one of the discussions that we had been having with them that they brought forward to us to ask us to think about and consider was, they're aware that we've implemented as many of the CDC recommendations for ventilation in commercial buildings and schools as we can, school by school, to whatever level we can. We've implemented those things. We've introduced as much outside air as possible. We've let windows be cracked where they can be cracked. We put the UV and the ventilation portable units in the health suites and one additional one for schools. You're also aware of all those things. But they ask us, to continue to think about, was there something we could do maybe more specific to classroom instructional spaces? And we bring those ideas to Dr. Lockard, review them with him, and he asked us to please press forward and see if we could come up with something that will be just one more additional layering mitigation strategy. And so I want to give a lot of credit to CCA for starting that conversation, but also to Mr. Prokop and his team, Mr. Hartlove, Ms. Codner, and their team for finding us a solution, a viable solution that already at least 2 Maryland school systems have vetted and or implemented. At least in one case we know is implemented. And we're in the process of procuring room-sized HEPA grade air purifying systems. So these would be a size unit that would work in a single space, in a classroom space. So they're not literally going to eventually be in every instructional space in the system. So I'll give you an easy example. In a large space like a gymnasium, it's not going to do anything to put one of these units there. So that's kind of like an easy example. But in most of our, if you think more about a typical classroom, we're in the process of procuring these. We hope to have them start arriving within the next 2 to 3 weeks, and then we'll do our best to work with schools even while they're operating to figure out, how can we get these things from here to the schools, and then with the building operations team have them up and running. So I'm not trying to oversell this as everything's, fine now and no one should worry about any of the other mitigation strategies. We all still have to do those things and wear masks and everything. But this is one thing we've tried to listen to our folks and see where we could find a solution. And I want to thank, Dr. Lockard for saying, let's go ahead and get that underway. So hopefully we can time it roughly with when we make this transition. So that's one not on the slides. With that being said, I think the rest of them, Cindy or other folks are going to cover.
Yeah, so for the second bullet, we want to definitely make sure that schools are communicating with their families to see which families are going to send their students back 4 days a week. That will be done from the school to the family, and then there will be communication back and forth because, as Dr. Lockard said earlier, we know that we're most likely going to get questions from parents about their particular child's classroom situation and, numbers of students that will be coming back and that their student will be in direct relationship with. We also are working on a diagnostic COVID testing plan. We are working with Mr. Singer right now to develop some regional sites within our system so that when students come to the nurse and they are exhibiting COVID-like symptoms, we will be able to provide COVID testing for them so that they don't have to go somewhere else in the county to have that done. We'll have locations at schools throughout the system to enable that to happen. So that's something we're working on now. It's not finalized and we don't have all the details yet, but it's something that's coming together for us. And then finally, at the last meeting, you had indicated a desire for a phased-in plan, not only with our special programs, but with elementary schools versus secondary schools. So with the timeline that we have, our plan was to begin elementary schools on March 15th for the 4 days a week, and then middle and high schools on March 22nd. Any questions about those?
Yes,
bullets?
Ms. Battaglia.
Regarding the potential of actually doing tests in the schools, this would not be conducted unless they have parental permission, correct?
That's correct.
Okay, I just want to make sure, because I know that was something that had been talked about actually a couple months ago, like, are they, how can someone test my child without my permission? But I just wanted to make sure that the public heard that if this is something we could potentially look at, that would have to be parental permission in order to be that done. So thank you very much. I appreciate that.
Dr. Lockert.
Right, that's part of what we're talking about here is part of what the governor announced, I think a couple weeks ago, where he was providing test kits to every school. We're looking, as Ms. McCabe said, at regional sites. We're not going to trace people who are not feeling well actually physically into schools where there are other kids. We're looking at sites outside of the school buildings so that, we're not cross-contaminating there. But it's a rapid test and a PCR test. And this is really helpful because if students or staff aren't feeling well, they don't have to wait to get in a queue somewhere to get tested next Thursday or whenever it is. We'll say, go right on over with parent permission, go right on over and get tested. And you'll get a rapid test and wait 15 minutes in your car to see what the result is. And then a PCR test will be sent away to double check the accuracy of that rapid test. That cuts down on a lot of things, waiting to get a test, waiting to get information back. We've been told by the folks at the state who sent this to us that it's a 2-day turnaround on the PCR test, which is great. So I think there's a lot of advantage for us to participate in that, and it's free. So at least the tests are.
Ms. Battaglia.
Follow-up question, would they, have they done anything as far as what the symptoms are? Like, have they done anything, they keep hearing about cough and runny nose. Well, we've had allergy season for quite some time, and now we're getting ready to really hit spring. Have they done any lessening of that where it'd just be the fever, or, if it is like the really harsh cough or the chills, instead of, because one thing I have heard from a couple parents are like, well, my kid was sent with just a runny nose. Well, 15 minutes after wearing a mask, my nose gets all stuffy. So I can only imagine with a child. But I didn't know if they had.
Nothing has changed with the symptoms, the list that we provide. I recognize that's a challenge with things like allergies and everything else. That's another challenge of COVID, is it certainly could present symptomatically like something else that is pretty common. So I think this tool allows us, the testing tool that we have, again, allows us to say, you can go right here, right now, and not have to, like I said, wait to get a test or wait for a result that maybe lagged somewhere. So that can only help us.
I feel with our employees getting vaccines, and then this is really putting us in the positive, the correct direction forward. So, Ms. Savigny.
I just wanted to talk about the phase-in aspect of this plan, because earlier we had deferred kind of our final conversation on career and tech to kind of look at what the full phase-in is. Mm-hmm. So this right here said that all schools would be on March 22nd. So only elementary schools would be March 15th. Then everything else would be March 22nd. That's not much of a phase-in. And I was thinking that career and tech could go earlier if we were talking about the 4 days. We made the change to the requirement for Wednesdays, how that could happen sooner. And I know that we're saying, we want to file this plan with MSDE, but I'd like to recommend that we use a file and use approach. We do know that there are several school systems, with the governor mandating that Maryland schools all open up to some extent on March 1st. There have been some other school systems that have filed plans where they're in 4 or 5 days a week in several situations, and I believe those have been approved. So I don't think that we should expect there to be an issue with approval of this plan. So is it possible to file and use it? Basically say, okay, if Career and Tech, if the only thing that was holding us up is the fact that we hadn't submitted the plan yet and it hasn't been approved, can we get Career and Tech to start sooner to have a little bit more of a phase-in approach to all of this?
Dr. Lockert.
Right, I'll let the board certainly discuss that. I do want to, address, as it relates to the phase-in, well, we've started phasing this week, granted, smaller special education programs. Next week, Ms. McCabe or Mr. Streeter, we're looking at Gateway Crossroads. That puts us into the first week of March. I am going to be recommending to the board that we allow for at least 2 asynchronous days at the elementary level, middle school, and high school levels before we move to the 4 days, because we're going to have to spend some time rearranging furniture, moving things around. And so our teachers are working incredibly hard. I need to be fair to them and their building level administrators. As they start to get a gauge on who's coming back, they're going to have to restructure their classrooms, reset them up. They're going to have to do some different things we've heard with cafeteria and other places. I need to give them some time to best prepare as best they can for students.
And you said how many days did you need for?
2.
Okay, I would suggest though not do it on the A cohort because they have lost so many Mondays. I don't know if that works or not, but I do know that we've had several holidays and things of that.
My recommendation would be the Thursday, Friday before the Monday.
That sounds good.
I was just,
Right.
that just.
Actually, so the B cohort is caught up though, because we had 3 snow days that were Thursday, Friday,
okay.
Friday.
All right.
So it's actually square.
Okay.
But there was a
But
holiday.
is
Okay.
it possible to do a Friday, Monday? So you take 1 day away from each
All right,
cohort?
okay. Well, I didn't think about that part. But, okay. And I understand, Dr. Lockert, if that's what we have to do to get prepared, we should not be complaining or if that's what we got to do, that's what we got to do. Ms. Battaglia.
I was going to say, with the phase in, we want to make sure that our staff and our teachers have time to plan to make sure they have the space, whether it's hopefully we can get the carpets back in the kindergarten and first grade and second grade's room so they can space out, on a floor and be able to get their materials ready. I think we need to make sure that our teachers do have that time to have their classrooms prepared and laid out in a proper way. To what Ms. Savigny was saying about, career and tech, I mean, is there a way that we can look at the 8th of March to get that started? And then, I mean that to me, that gives some of the elementary time to prepare because they know this is coming. So that kind of gives them a little bit more time. They can do some work a little bit here and there. I'm just trying to think of ways to get things prepared, going, and the community to understand.
Okay, I want to jump back for a minute. Dr. Lockert, we talked about elementary and you wanted 2 days. We need those dates so everybody knows it right now. That would be,
The 11th and the 12th.
okay, and I just want to make sure that everybody knows that.
Right, and obviously, once we have this conversation, we'd communicate all that out as we typically do after these meetings.
Okay. Do you need anything else for elementary?
I'll ask Cindy to chime in I think we've worked through some of the challenges with what we've talked about with social distancing.
We're here to help, and, just like we got through special ed, and we saw that there was a problem in career and tech, and we took care of that. So, March 11th and 12th.
And what date did you say for Gateway?
Monday.
This coming Monday?
The 1st.
Yes.
Cindy, is that still accurate?
Yes.
Okay, so that was Gateway and Crossroads are
Monday.
March 1st.
So like I said, we started with a bunch of special ed groups,
So
4 days
we
a
are
week this
moving
week.
forward.
Gateway Crossroads next week. We have a little bit of time at the end of the following week to start the transition for elementary school, a little bit of time at the end of the following week, the 18th, 19th, to transition for secondary schools, and wherever the board lands with career tech.
Thank you. So we have to decide on career and tech. Because it says all of the schools March 22nd. And Tyra, what date did you say?
March 8th.
Mr. Kyler?
And the career and tech, probably some of them are gonna kill me in my sleep. Monday's the 1st.
Yes.
We're doing some phase-in stuff. I still think we're causing complications with high schools that we don't need to. Listening to career and tech tonight, I think it would be aggressive to think they can be ready in a week. And I want this to work. I understand what you're saying and you're saying, but I want it to work and I want it to be successful. And again, if we say the 8th, we're talking 2 weeks. And I'm not sure it's worth the jumble in transportation and some of the other stuff. I think focus on elementary, get it open, focus on, and I'm so glad the Gateway's already open. I mean, that was needed. And,
Well, this Monday coming up, it'll be open.
yeah, and I think we ought to just let Gateway go with the high schools, especially since they're now 4 days like the high schools. I think it helps simplify some things. And I understand what you guys are saying, but I think that's really how I feel about it.
Wow. Okay. Devanshi?
Well, I just want to go back to a past point that you made, and I've been talking with high schoolers throughout the past 2 weeks as well. And as I mentioned before, only 34% of high schoolers are currently coming into hybrid. And I don't really think that opening more is going to encourage more students to come in. And that's why, again, I'm kind of at odds is if we're trying to maximize the amount of in-person learning each student can get, then I don't really see how, especially for the high schoolers, the limited amount of people in a 4-day would be conducive and the best for everyone.
Ms. Savigny?
And Devanshi, I appreciate your comments. I'm trying to understand why that wouldn't be maximizing. So with only 35% of the high schoolers coming in, we can still meet the socially distanced guidelines in most instances.
Absolutely.
Right? So the fact that you're actually increasing those students who are choosing to come in person, they're now only getting 2 days a week. If you open it up, they get 4 days a week. That is maximizing in-person instruction for as many kids as possible. I'm not sure I follow the argument.
And I agree with that. It's just, I also think that we should be trying to make sure that those who would want to come in and encourage people to come in if they would like to do so. And I know that as the cases are becoming lower, more students are becoming a bit more comfortable with possibly going back to hybrid, especially at the high school level going into March. And I just think if we move into a 4-day format with that right now with high schools, those who would have been comfortable with coming in 2 days for hybrid, they would lose out on any in-person learning at all.
Well, they still can come 2 days a week now
Can come in
Now they could.
Yeah, now they can. Up until the 22nd, they can get their, they can give it a shot. Mr. Kyler?
Yeah, and I kind of heard the same thing from some people. We're just ready to start hybrid. And what I said, then start hybrid.
Right.
Well, they didn't. I think, I understand what you're saying, and I know there's a lot of concern out there, but I think, and like Ms. Savigny said, particularly with only 34% in there, and I'll be honest, I hate to be this way, if 4% of them drop out and don't want to do it, then it'll be easier to social distance. I think, again, I was saving this for the last, but Maryland is the last of all 50 states in educating their kids right now in person. West Virginia yesterday said, we want full, their COVID czar said 3 feet's enough, I want schools open fully. We're not ahead of the curve. We're not, some days I don't think we're close to the curve. I think you guys have done miracles. But we need to get open. And I think the sooner we do, And I've seen this in businesses, I've seen this in work. Everybody's afraid of this, afraid of that, and they do it. And it's just like, I mean, I'm biased, but our vote in January, we pretty much, there were some people wanted to crucify us. Numbers have dropped since then. We did sports, we did schools, we didn't hurt the community. Schools aren't super spreaders. Somehow, we've got to pull off the Band-Aid and do this and let people say, oh my gosh, this works. And I'm going to get criticized for this. I'm more concerned about staffing issues than I am health issues because, I mean, I drive past a school every day that's been open since August, and they're doing fine. It's not we can't let the fear of health overcome the fear of 18 to 24 months of recovery learning. I just feel strongly, and I understand what you're saying, and I'm hearing some of the same messages, but I think we've got to get the kids in school face-to-face in front of our great teachers learning.
Okay, so Mrs. Savigny?
Yeah, I was just going to say, that was well said, Mr. Kyler, and I agree. And since we opened up, the number of community cases has dropped off substantially. I mean, we're back down to levels that we were at back in the fall when we were talking about this. And we have to get past the fear. We are, while Carroll County is ahead of the rest of the state of Maryland is behind most other states in the country, and we have to get past this. Like, everything is going in our favor at this point. We've got a significant number of teachers vaccinated. We've got the community cases dropping way off. We have a plan that we're putting together that we think we can socially distance to the greatest extent possible. We're planning this out. We're taking very concerted steps. We need this as the next step in the recovery plan for our students. And we absolutely have to take that next step and just get past the fear.
Yeah,
Dr. Dorsey? Whoops. Okay.
And we have to give our parents the choice, right? Like, we're saying that we're
Everyone.
communicating with our parents. We've done everything that we can to protect staff. Now the situation is with the kids, and we'd say, look, the schools aren't the super spreaders. The kids, if and when they do catch it, it's much more mild. And we're going to give parents the choice of saying, we're going to let them know where we're not completely socially distanced to the 6 feet, and that we're going to give them the choice to say, this is what our kids need, right? So we're giving the choice to the parents.
Devanshi, did you want to finish up here? Because then
Yeah,
I'll have
I
Dr.
guess-
Dorsey.
Yeah, just one last thought is that, especially in the case of high school, where, as I said, like 34% are in, I feel like we're working towards the benefit of those 34% of high schoolers that are in school versus all of the high schoolers overall, which is why I am, again, like very concerned about this. And a lot of high schoolers have reached out to me and said that they have also been very concerned.
Okay, thank you. Dr. Dorsey?
Well, again, I hear the parent choice certainly is still there, which is something I think that's appealing for certainly some of our parents. But again, looking at the data that has been shared, I mean, it's encouraging. I mean, we're getting to where we need to be. And again, not saying we're totally there yet, but, as we looked at it earlier, certainly with the positivity rate, it's there. And really looking at that 60.5 as far as the new cases, I mean, it's almost where it needs to be. So again, if we keep the trend moving in the direction that it seems to be moving in now, and with looking at more of this phased-in approach, I think there are some good options that are out there for our parent community and for our students. The bottom line is, and we usually say it at every meeting a number of times, but certainly we want our kids in school, because again, we know that face-to-face interaction is really what's needed, as well as the social setting in a school. If the numbers continue to trend in the way that they're trending now, we keep the vaccination rate up. I mean, that's very encouraging to hear the number of staff members who've been vaccinated just in one day. So if we can keep that going, and then again, get these extra weeks in as far as prepping rooms and getting ready for the students, I think it's all looking like it's heading in the right direction. And again, I know it gets confusing because in one sense we're saying, here are the recommendations, but then again, on the other hand, well, they're not really the regulations. So I think when you sort of piece together all of the information that we do have out there, and with the work of Dr. Lockhart and the staff, and, certainly I, for one, just really appreciate hearing some of the challenges that you're facing as far as, making the schools more open for the students. And again, I think in sharing those challenges, we've certainly come up with some solutions in at least a case or two. So we just have to continue to problem solve together and do what we can do to make school look more like school should look. So anyway, I'll just end with that, but it looks like we're headed in the right direction.
I'm glad to see the staggered openings. That was one of my biggest concerns, and it was, I didn't want to see us doing a full-fledged, and here we go. I wanted definitely to see something stagger, and I'm glad to that is occurring. I did have a couple questions. ESOL students, has there been, when are those going to begin to have more time?
Mr. Anderson, ESOL students.
Yeah, absolutely. So a number of our schools have already started making sure that our ESOL students are coming back with more opportunities. That being 4 days. I believe Mr. King can speak to a couple high schools where that's happening. I also want to let the board know that we are also putting together and writing at the direction of President Herbert. We are writing a ton of grants to make sure we provide an abundance of opportunity for our ESOL students throughout the summer as well. But we're continuing to reach out and getting those students to come in. So this will be something that will be sure of benefit for all of our ESOL students to have the opportunity to be in 4 days a week.
What about 504 and IEP students?
Yeah, so our IEP students are very much our most severe students that need the most support. They are in our specialized programs, which have started this week, and we're going to continue to increase that and scale that up over the next several weeks. And then obviously, as we transition in, they will have the 4 day a week opportunity. The one challenge that we'll have, again, just being realistic, is that we're working hard to get as many SSAs and IAs into our buildings to support all of our students, and so that'll be something that we're working really, really hard to make sure that we can provide appropriate accommodations as we move forward. 504 students, very similarly. I'm sure Mr. Streeter could probably speak more specifically to that, but as far as the planning and the implementation and the oversight, that will be very much a priority as we continue to move forward.
And we briefly discussed about this yesterday at the CAC meeting, state testing.
Yeah. If I may, Dr. Lockhart, we received information from the state yesterday. We are aware that state testing will happen this year. Students will be sitting for the MCAP examinations. We did receive a waiver from USDE as it relates, or the state did receive a waiver from USDE as it relates to accountability that is being counted against our students, considering the environment this year. However, our students will still be sitting for the MCAP in the spring. There will be some modifications and revisions to the window of assessment that will be taking place. The primary purpose of it will be for a diagnostic measure. It'll also be doing some norming of the items at the state level. And what we're looking at is a more succinct, a more abbreviated experience this spring with our state assessments. I do want to commend our high schools for being one of the few school systems that actually provided the government as well as the science test that took place earlier this year. So I believe Dr. Lockard was in a meeting where a number of superintendents had not done that yet, and that is a state requirement. So we are very much ahead of the game on that.
So with the USDE putting a waiver in for that, are teachers, like, do they evaluate teachers on that too? Because I don't think that'd be a fair assessment that teachers would be evaluating on this either. I think it's just.
Yeah, and so the accountability, so what I'm referring to there, Ms. Battaglia, is that the students will sit for the exam. It's probably going to be, yes, we'll look at it from a curriculum standpoint to be able to identify resources and mapping to prepare our students and teachers and placing them in a position to be successful. But I believe the primary purpose of the assessment will be that the state will be able to take a look at those items as they're developing the new MCAP in multiple grade levels. I don't anticipate us having any type of additional angst placed on our teachers because of the inconsistency of the environment this year. There's, as you all know, there's a number of school districts that still haven't brought students back yet. We're very fortunate to have been working with students for a number of months now.
That was something I was hearing from some teachers too, is they were like, now their stress levels and the students' stress levels might go up because they're going to have these standardized testings. And I want the public to know too that, we're going to be, we're saying, like, please don't stress over it, because we know that this is not the normal situation. This is not the situation we want to be in. Teach the material the best possible. I think I told you last night, I don't think it's the right year for any type of standardized testing, but we have to do it.
I can't say I don't disagree with you. And I will let you know also that we have already started, Lauren, our local accountability coordinator, has already started drafting some communication that we're going to be providing to schools that sends that message.
Good.
She shared that with me, I believe, 2 days ago.
And Mr. Anderson, I need to thank you if you're getting grants for those ESOL students, because, 2019, we were the 47% graduation rate and a 17% on MCAP. And when I went to substitute and I saw that one little girl and she didn't speak to anybody, and then somebody else told me that she is non-English speaking, and I couldn't even, I said hi and I smiled. Well, I smiled underneath my mask, but I just, I just thought, we're not getting to them. Thank you.
Yeah. Yes, ma'am. And smiles in your eyes, right? So we're recognizing that now. But I will also say that we are submitting, as of tomorrow, Pam Mess, the ESOL team, is submitting a $1 million grant that focuses on 4 areas. And one of those areas is providing summer opportunities this summer for our ESOL students, in addition to the academic recovery that we're planning, that we'll be sharing with you, I guess, in 2 weeks at the board meeting.
That was a really good discussion yesterday with CAC when Mr. Anderson was talking about the recovery and the opportunities that are going to be available for our students for that. So I'm excited for you guys to hear that piece.
Mr. Frazier.
Yes, thank you. Mr. Anderson, when you say students have to sit for the exam, what does that mean? Does that mean they have to come into school physically, or can they do it virtually as well?
No, so basically what those students, I believe the direction that we've received from the state, and Dr. Locker, correct me if I'm wrong, but basically students that are in the building will sit for the exam. I don't believe there's any additional expectation that we would have to administer this examination virtually. That's just not, it's not in line.
Mr. Anderson, I don't know if that's been determined yet. Okay. I tried to catch a little bit of that state board meeting in between a bunch of things, and I know there was some discussion about considering options for virtual students. I'm just not exactly sure how that would look, and how that would be delivered with test integrity and whatnot. So, so more to come on that, Commissioner Frazier.
Yep, absolutely.
Right, and
Go ahead.
I just wanted to piggyback on that. I was in a meeting this morning as well where testing was brought up. And again, I hear that it's certainly going to be a shorter exam for the students. But then there was some conversation all around the virtual learners and how we would possibly just have to have an attitude of trust and have the students possibly take the test, somehow be tested virtually. So it's still in the discussion phase as far as I hear. And the state board president and vice president were sort of seeking some information, some input on, how it could possibly be done. But
Yeah, I
it's still
think
in,
the validity of it would be in question.
right.
Yeah. Mr. Kyler?
Yes, Ms. Battaglia asked a couple of my questions, but I still have about 6. First off, I want to say thank you, Dr. Lockhart, and I think there's like 25 staff on the meeting, and not only did this plan come together quickly, it's posted on the website, it's totally transparent, everybody gets to see it, and I know it's a lot of hard work, and I'm so glad, like I say, I'm glad everybody's realistic, but as positive as they can be. This is tough. I think the mitigation stuff, again, CDC said if you have to squeeze social distancing, look at other mitigation measures, look at better contact tracing. You kind of surprised us tonight with some ventilation and the testing, whether parents don't want it or do want it, it's still a good opportunity to speed things up. So that's great. This is more on probably implementation, but I'm just curious. We talked tonight about flexibility about days and flexibility about stuff. How much flexibility extends all the way down to the team level, the teachers in the classroom? Again, I think you always want people being as flexible as they can be with supervision, approving what they're doing, but in today's world, that's even more necessary. What happens with that? And I know, and I mentioned earlier, stakeholders were involved in this plan in the beginning, and I assume through the chain of command, the people on this call asked the principals in the school who asked the teachers, and there's lots of input from everyone. Could you just touch on that a little?
Sure. I mean, well, just, moving into the hybrid when we did back in the fall and then again in January, that none of our schools are exactly alike. None of the configurations are exactly alike. And it behooves us to tap into the expertise of our building level principals and our talented teachers and staff. And so to really just, directly answer your question, we rely on the creativity and flexibility of our school-based staff to make these things work. I saw it in action as I visited schools, not only in the fall, but obviously right now while we're in hybrid, where people have come up with some creative either configurations or ways of doing things that still meet the intent of what we're trying to do, and it works for their school. And so we encourage that and frankly need that to make things work.
And then the dollars of all this. I know a lot of people, I've even heard people say what we're doing is not cost effective, and from my position, whatever we can do to get these kids recovered as quickly as possible is going to be cost effective. But I think you guys have done some great stuff. Mrs. Herbert and Mr. Anderson just talked about another grant somebody found. From what I've heard and from what our reports have been various meetings, between grants, between money, we've been updated every month, and we're doing okay. Now, I want that to, that's a positive message, and that's great, but in turn, if we really want to grow and do recovery and help the employees that have been doing all this stuff, we desperately need all the funding we're asking for next year. I don't want to say like you're banking away money or something, but I think you're being cost effective. Could you elaborate on that a little?
I'll do my best. We're obviously taking advantage of all of the one-time funding that's coming our way, whether it's ESSER or the original CARES funding or any kind of other grant funding, because of the things that we've talked about at our regular meetings, whether that's all the PPE or, as we discussed tonight, air purifiers, HEPA purifiers for all of our classrooms, you name it, technology. We've been through all these things, and they're listed on our website. We're trying as best we can. We're also forecasting, and you'll get this in March, what the next 18 months are going to look like, and we're going to very quickly go through all that one-time money, which is why our budget request, I believe, is appropriate as we think about how we best support not our employees, but our students in continued recovery. And one of the things that drove a lot of our conversations from the beginning throughout this pandemic was mental health. And so we've been talking a lot about instructional needs, but we also have mental health and support needs. And so all of that is built into the ongoing budget. Our employees and their compensation, our students and their instructional progress, as well as their mental health and well-being, those are the things that are baked into the ongoing budget request. So as I have a captive audience with Commissioner Weaver and Frazier, I'll take that opportunity, Mr. Kyler, thank you for teeing that up, to say that those things are really important.
Okay. As we're phasing in, we started sports, and I think overall that's been successful. We've talked about possibly, once we get outdoors, allowing spectators, but then just as important as the sports are all the other extracurriculars, drama, band, chorus, whatever. Are they all being phased in also to some extent?
Mr. King, you still with us?
Yes, I am. Yes, as a matter of fact, there will be some marching bands participating in our fall winter fall football games, but some of them were not able to participate because of when the courses are offered, which is basically first semester in most of the schools. So the short answer is yes. There were a couple different virtual drama productions that have already occurred. There are some other things in the works, and there are some more traditional drama productions that are, of course, going to have some COVID limitations in place. But so the answer is yes. It's not fully, we're not there yet where we'd like to be, eventually. But yes, some of the other activities are beginning.
And then back to like spectators at events, which I don't know if you're ready to talk about that a lot tonight or not, but in general, and I can make this hopefully my last question, potentially numbers are going to decrease. As numbers decrease with this plan, let's say, I don't know, 3 weeks from now, the governor says, well, you really don't need a mask, or CDC says 2 foot's plenty. Do we have to modify this, or is it understood we can eliminate mitigation? And I'm looking at this twofold. It's tough on the kids, but I always say kids are smarter than us, they adapt. It's tough on the staff, so everything they have to do on top of teaching. Can that stuff be minimized, and can that be phased out, or is that something we have to modify the plan and do, or as the governor or whoever puts out new guidelines, we can just adapt?
Right. So things have evolved throughout this whole process, and we have adapted. So to answer the question, if the governor, through an executive order or a proclamation, or the state superintendent or the Maryland Department of Health through a decree says you must, then, or you can pull back from, or whatever it is, one way or the other, we will adjust, and we don't need to necessarily go through an entire process as we're doing now. So, as far as spectators at sporting events, we are. Mr. Duffy, are you on this evening? I think you are. You and I talked today a little bit about this.
Good evening, Dr. Lockard. Yes, I am.
Would you like to
Good
give an
evening, board
update?
members. Good evening, commissioners. With regard to spectators at sporting events, we are going to be working with a mobile platform called GoFan Huddle Tickets this year to remove cash from the situation, so there won't be, to make it a little bit cleaner. And also, it'll be tickets on the phone, which will require less contact and allow for more spacing between staff and spectators.
Now, will this information be on each school website or the county?
It will be. We will have a centralized thing. I'm working on writing it up as we speak, Ms. Herbert.
Sorry.
I appreciate that.
I'm
It's
excited.
going to be different for the different. It's going to be different for different sports.
Okay.
At our outdoor facilities, we are limited by the governor's order and the Maryland Department of Health order to 250 spectators. That is our limit. So our plan for soccer and for junior varsity football will be that we would allow for 2 tickets to be purchased for each home participant and each visiting participant. With varsity football, that may be complicated based upon the size of cheerleading teams as well as the size of bands as they may participate. We will still work with 2 tickets able to be purchased for home participants, but visiting participants will be based upon how many tickets we have remaining once the home participants have had an opportunity to guarantee the home events. We will be distributing, for lack of a better term, kind of sideline passes, cards with lanyards for field hockey, cross country, and golf. We're going to ask parents to. We'll be distributing. Our plans to distribute 2 per player to take home so that parents can attend. We're going to ask their assistance with us to keeping it to the 2 so that we don't, because if it gets beyond the 250, we are then out of compliance with the governor's order. And at that point, we simply may need to shut down attendance altogether. And we don't want to do that. We don't want parents to miss opportunities to see their students. We are working currently to have the cameras in the stadia calibrated so that they'll be working through the NFHS network for people who are not able to make it to those events. Cameras will be working still in the gyms. We finally got our last one after quite a long season. We had some issues at Century High School, and I can't begin to thank Mr. Randy Pence, the athletic director there, enough, because he was on the phone and on email, I would say probably 8 to 10 times per day with the NFHS network, getting that camera calibrated, getting a new computer installed. It was really a lot of work, and he did the lion's share of it. So I certainly want to commend him for the work he did. But with regard to volleyball, we're going to hold to keeping fans out of the indoor facilities for the time being. It's our expectation we're going to get through this spring fall season in that manner. But we are expecting that we're going to have up to the 250 spectators in attendance. If that should change, based, as you referenced, Mr. Kyler, a governor's order should change that. To be fair, it could take us up to a week to adjust our ticketing accordingly. For example, if the governor has a press conference on Thursday and says, okay, now 500, we are not going to be able to just open up tickets to 500 people the next day. So we're going to need a little bit of lead time for that. Did that answer your questions?
Yeah, thank you very much. And for record, Ms. Herbert's president, so she gets to interrupt all of us.
Well, I was excited, and I'm glad to hear good vibes there. That's great. Because we have gotten a lot of emails that, people do want to see activities outside.
Yeah.
And rightfully so.
Well, I'm certain they do, and we'll see how warm it is on the first couple of weeks of March on how seriously they want to see it outside. Because there's a difference between wanting to see something outside and sitting in the frigid cold outside. The other issue we will have to deal with in all of our events is all spectators, again, falling back to the MDH and the governor's orders, and the governor's order will require face coverings and social distancing. Those are not Carroll County Public Schools guidelines that we're setting. We're following the state's guidelines, so we will need to enforce that.
Okay. Oh, well, thank you. And I have shoveled snow off the track in the spring. Okay, Ms. Battaglia?
I'm glad to hear that because, as Mr. Kyler and Ms. Herbert had said, we had received a lot of emails from parents, asking about the band spectators for outside sporting events. I'm hoping that there will be some type of band competitions. You never know. Drama productions outside could even be done. Potentially that's the way they want to go with that as well. So I think it's important for the arts too to take advantage of the outside activities. I'm glad to hear that parents are going to be given some type of, lanyard so they will be able to go and see their student. I'm kind of iffy on the 250 number. Like I sit there and I'm kind of like it's like creeping up my spine. Like, oh, that's a high number to me. But I think outside there's enough space. There's enough space for that. And even with the outside, hopefully it gets warmer soon. It was a nice day today, so that'd be nice if we could stay this way. Classrooms outside. Making sure that, and I want to make sure that, our teachers are given that information that they can move their classrooms outside for more space. and even potential lunches outdoors too. So I'm just glad to see that we're moving, we're going good. Yeah.
Anything else? Now we need to get back to career and tech, and we need to figure out, are we going to open it up on March 22nd with all other schools? Are we going to move forward and do an earlier date?
And once we do that, we approved the original reopening plan, so do we need to make a motion and approve this? Or we
Yes,
do?
I believe you would need to
Yes, I need-
approve the modified.
So we need to get the pieces right and then make a motion and approve the whole thing? Okay.
So in order for us to discuss this more, then we need a motion? Yes, we need a motion. If you want to change it.
So, well, we had already made some I had made some comments earlier
Right.
about changing those 4 sections, changing the wording that was identical in those 4 sections of the plan. So
yeah, that
we're
has-
saying, so I'm just, did it say specifically in the plan what the opening dates were for different schools? That, I mean, that's not really part of the state plan submission, right? So, do we want to approve the state plan with that one change that we requested?
Do we need to do that with her?
Okay, so under that circumstance, I did have one additional thought, like, so after reading through the reopening plan that we were going to submit to the state, I was thinking that it might make sense to add a message from the local Board of Ed to the end of that plan. I had drafted something, it kind of going through our logic for how and why we got to where we are today. I'm not sure that it's necessary, but I just, basically I had drafted some wording saying, we believe in-person instruction to be essential. We've seen, we opened successfully in hybrid on January 7th. We've seen a significant decline in community transmission and number of cases since that time. So we've shown that schools aren't super spreaders. We've seen a significant deterioration in student academic performance and mental health during this situation. So we really feel like this is the next step of our recovery that we need to take in order to support our students and start the path to recovery. So I had drafted something. I don't know if we feel that it's necessary to put it on the end of the state plan, but.
Do you think should we do a cover letter, or
That's-
should we do?
That's
leave the plan?
entirely up to the board.
I was going to ask you what your thoughts are, how people have done it. or-
Because we didn't do anything before.
Yeah, we didn't do
right?
anything
We
just
didn't
had
do
them
anything
submit the
before.
plan.
No, and I don't know if any other boards in Maryland did that. It wasn't a requirement of the plan submission. So that's entirely up to the board whether they want to include that or not.
By matter of form, Dr. Lockard, we do submit under cover letter. So normally we would just draft that to explain, why we're submitting and what's involved. But if the board wishes, we could make a point to include that statement within the cover letter.
Yeah, I like that.
Okay. Any other comments?
So should I forward that to the board under separate cover, and we can say that this is the wording that we would like to have included in the
Okay.
cover
that's fine.
letter? Okay.
Sure.
And then we would also make that available on the website as the final version that gets submitted.
Mr. Weaver?
Just one question. What happens if you submit the plan and they come back and say social distancing's not debatable, it's going to be that or whatever? What do you do?
I guess they're going to close everybody up then.
I'm
All
not
over the
sure.
state.
It's not negotiable, you're going to give you a detail, something, what happens?
When the state responds to you, you'll see what their response is, and then the board would meet again.
Okay. I just happened to
No, I mean,
thinking too much.
it's a valid question, right? But I don't expect it to happen because I have seen plans from other school systems in the state of Maryland that have been submitting where they're saying the same thing we are, that they're gonna social distance to the greatest extent possible. There are some situations where 6 feet is not attainable, but to the greatest extent possible, and they're being approved. So, or at least we're not hearing that they're being disapproved.
No, we don't have a motion.
So I would like to make a motion to approve the reopening plan that we submit to the state as submitted to us with the one set of revisions on the 4 pages that we discussed earlier. So a slight change to the wording on pages 42, 43, and 58. That's my motion.
Is there a second?
Second.
Okay.
I beat you guys.
Any other discussion? All right, I call for the vote. All those in favor signify by saying aye.
Aye.
Aye. Opposed?
I would like to abstain.
And it passes unanimously. No, it doesn't then. We have one abstention.
One abstention.
Okay. All right, now, as I have my phone here, Career and Tech, we have to make a decision. It says March 22nd, all other schools, so, and we've had a lot of discussion. Does anybody want to make a motion to change that? And if not, then we will continue on. Ms. Savigny.
And personally, I support the 8th and doing it in more of a phased-in approach for career and tech, but I will defer to this. I don't think it's necessarily our purview, like, to get into the absolute details. We said that, by March 22nd, and, you come up with the plan and we'll sign on. So it's like, while I would say that I personally prefer the 8th and think that that would be better, I defer to the fact that that's more operational than strategic for the plan, for the board.
I thank you, because Ms. Donovan and Mr. Eccles would prefer that to be March 22nd. Is there anything else?
Do we need to make a motion to approve your wording for the cover letter? Or do we, does that even need to be a motion? We can just do that, right?
Yes.
Okay.
All right, anything else?
So do we need to make a motion to approve?
Her statement to go in the cover letter?
No, I guess I was thinking, so we said Gateway and Crossroads would be on the 1st. So special needs programs are happening on their own separate path as previously outlined. Gateway and Crossroads are March 1st. Elementary schools are March 15th, and then all other schools, including career and tech, would be March 22nd.
With a change with asynchronous on March 11th and 12th for elementary, and 18 and 19 for all others.
And where does Carroll Springs fit?
So as we discussed, Carroll Springs has already transitioned some of their students to 4 days. We talked about giving Ms. Rockefeller the discretion where she can do 5, she can, with medically fragile students or other special circumstances, using her discretion there. So they're already kind of in that mix of getting started and going.
Okay. So those 2 asynchronous days.
Yes.
And the fact that career and tech would now be, it's 4 days a week with Wednesdays being the theory.
That wording needs to change in the plan. That wording was in the plan, wasn't it, Dr. Lockhart?
Can you say again, please?
The gateway was 5 days is in the plan.
Yeah. And
Oh, you're
Cindy,
right.
Miss McCabe, are you still there?
I'm here.
For Gateway Crossroads, they're going to be operating at 5 days, correct?
Yes, Gateway and Crossroads will be able to operate 5 days.
Starting March 1st.
But career tech will now be 4, and
Right.
it said all of them were 5, right?
Correct.
So we need to
We-
technically change
That will have to
in
change
the-
also.
Right.
in the plan.
Okay.
So Mr. O'Neill, I think he's keeper of the plan. I think he's got that. Yep.
I do, and so once you vote, I
All
would
right.
make revisions to reflect your
Okay.
motions and votes here.
All right, now, do we need to?
So
vote?
that was the motion with
Okay,
all of
all
those
right.
pieces.
So
Oops. Tara?
You guys had said the asynchronous days were the 11th, 12th, and the 18th and 19th. I thought we were only doing 2 days.
Well, it's for the other group of schools.
Right. So on the 11th and 12th, the elementary teachers would have, and students would have asynchronous, not everybody else. And then on the 18th and 19th, the secondary folks would have asynchronous, not the elementary folks, because the elementary folks will already be in 4 days a week.
Okay, I just want to make sure that was kind of understood, because I'm
We'll-
like.
We
I'm
will
like-
communicate that as clear as we can. Yep.
All right,
So that was the motion.
That was the motion. Do I have a second?
Second.
Okay,
thought
Mr.
you already
Kyler.
did.
All right, I think we've discussed this enough. All those in favor, please signify by saying aye.
Aye.
Opposed? Okay, it passes then. All right, anything else? I have one little more thing to say. Go ahead.
Oh,
miss.
oh,
Go
okay.
ahead.
I would say, we wanted to talk about a message that we're providing regarding school in the fall, right? Our expectation as a board of what things are going to look like in the
Yes.
fall. Oh, okay,
Yes.
that's what your
Okay.
one thing was.
Yes,
Okay.
that's my last thing. And I talked to Dr. Lockard. First of all, I'd like to thank all employees for all their hard work, making great strides in getting our students back to the classroom. This was a huge endeavor by all, and to keep all of our schools open through all of this. There's nothing better than a teacher teaching in front of a classroom full of students. We are a very forward-thinking Board of Education, and will continue to be diligent until our schools are open 5 days a week. We have lost many students to private and home schools. We are planning to be open 5 days a week on September 8th. I hope this will put to rest the many inquiries about the future of Carroll County Public Schools for the fall of 2021, because we have been getting a lot of those, and people are making decisions about whether they're going to go to private school. And I talked to Dr. Lockard, and he said I could say that we plan on being open 5 days a week in the fall. So I just wanted to let everyone know that, so there is no confusion. Anything else for the good of the order? Ms.
So-
Savigny?
Just a couple of statements about that. Like, so I've seen a lot of emails to that effect as well. Like, I think it's a really good thing for us to be sending that message to the community that is our intent to be open 5 days a week on September 8th. Should the situation warrant it, like, we can always be talking throughout the next several months, like if there needs to be some sort of virtual option, that would have to look very different
Yes,
than what we did this school year, right?
Yes, it would.
it will.
Right.
Yes, that's not, yes.
So, but for all students and parents who want it, there will be school we intend there to be
Yes.
school 5 days a week.
5 days a week.
in September.
Yes.
In class.
Okay,
All right.
thank you for that.
Okay. And at this time, I need a motion to adjourn.
So moved.
And by Dr. Dorsey, and I need a second.
I'll second.
Ms. Savigny. All those in favor signify by saying aye.
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 And opposed? It passes unanimously. And I really want to thank everyone for all their hard work. I really appreciate it. And have a great evening, guys.
Thanks, everybody.
Thank you.